everyone. This is a work session of the Portland City Council. This is March 18th, 2021. And this is a budget work session. I believe this is the third in our series. Director Kennard, kick us off. Good afternoon.
Good afternoon, everybody. Thank you for being here. So today we are focusing on community safety. We will begin with presentations generally aligned with our safety system and upstream work. We will take a short break and then we will move to our first responder bureaus. And so I am going to turn it over actually to the Bureau of Emergency Management, the Office of Violence Prevention, and the Parks Ranger program to kick us off. And I believe, Keelan, your team is driving that presentation, if you wouldn't mind pulling that up.
Thank you. While they are pulling up our presentation, my name is Nike Green. I'm the Director of the Office of Violence Prevention. Thank you all so much for allowing us to be here. Respect to all of our commissioners. It's so important for us to invest in our shared priority around public safety and livability. And we know, because if we don't, that there is a cost, and that cost is too high. Just in regards to our element around shootings, that no matter what, $670,000 go out the door for every shooting injury, and 1.4 million goes out the door for every homicide. For the last 2.5 months, we've already invested over $77 million. So investing in prevention and intervention service is a must, because if we don't, the cost is too high, and that's just the numerical cost. Community mobilization and citywide collaboration are essential to ensuring public safety and the developing of a resilient city. It's not by chance that PBEM and OVP and Parks and Rec are actually on the same docket. This is not the first time we've worked together. We literally, during the summer, all collaborated together because we believe in the power of collaboration and community mobilization. We have collective goals and shared cross intersections of our work. And we have collective priorities, just like you, around public safety and livability. So whereby PBM supplied masks and hand sanitizer and park rangers and outreach workers and community members, instead of going and policing all of these different parks over the summer, we realized there was a need, and we met that with education, we met that with service. So today, as we stand before you to talk about what we do and how we do it, we're going to reevaluate our core values from the city around equity and collaboration, fiscal responsibility, and how vital they are to public safety and reducing gun violence. So we ask you just to lean in and listen and to help invest in what we do on the law enforcement side, going upstream, looking at primary and secondary prevention. So with that said, I'm new to this. I apologize. I should have said next slide a long time ago. Next slide, and actually to the next slide. I am now turning it over to Jonna. I would say I call her my partner in crime. Thank you.
Thank you so much, Director Green. Can you advance to the slide on PBEM, please? Thank you. So my name is Jonna Papet-Feniu, for the record, and I'm the Planning, Policy, and Community Programs Manager at the City of Portland Bureau of Emergency Management. And today I'm going to give an overview of PBEM's budget and our programs, and then focus on the work that we're doing to contribute to getting upstream from disasters and emergencies. Next slide, please. So just as a reminder, the vision and mission of PBEM is to build a resilient Portland, and to do that in partnership with our residents. And PBEM represents 0.1% of the city's total budget. That is 1/1000th of the budget. And I mention that because if you take nothing else away from our presentation today, I hope you will get that is among the hardest working portions of the budget. Next slide, please. For that 1/1000th, the City of Portland gets first the Regional Disaster Preparedness Organization, which is a regional organization that works to coordinate emergency response and preparedness among 5 counties. But PBEM is its institutional home, and we have the opportunity to influence their programs and be influenced by their thought leadership in the region because we are their host. We also have the city's Emergency Coordination Center, which is a resource for the whole city that is always open and able to be activated at any time in response to a catastrophic event, and in fact has been activated for over a year now in response to pandemic planning and activities, and it also ramped up in the past year in response to wildfire smoke, Johnson Creek flooding, and severe weather events. We also have in our operations program a 24/7 emergency duty officer. Within 5 minutes, you can always reach a person at PBEM that can help you activate the ECC for response. And also sorry, I'm reading the chat now. I hope that's not my static. To activate the ECC for response, and also can activate the community emergency notification system and get an emergency message out to city employees or residents anywhere in Portland. Next slide, please. In terms of the planning program, PBEM is a coordination program, and we support continuity of operations planning for the entire city. So we have staff and software that we make available, so all bureaus have a plan to continue their essential operations in the event of an emergency. And we also keep the playbook for emergency response for the city, for landslides, for earthquakes, for floods. That's a citywide effort, but we coordinate that. And also in coordination, we run the Emergency Management Steering Committee. So we meet with emergency managers from all bureaus at least monthly. And then our community programs. These are the programs where I think we show the greatest leadership really nationally. We have the largest local emergency volunteer program in the United States. I'll say that again. We have the largest emergency volunteer program in the United States. It's bigger than New York, it's bigger than LA. We have over 2,000 active volunteers, and we also do a lot of direct outreach to residents, and we focus on communities of disability and BIPOC communities. Next slide, please. Great, so this gives an overview of our spending. If you'll see on the right-hand side, that dark blue is the RDPO. That program is entirely federally funded with grants. And so we benefit by their thought leadership, but those resources are really not directed to direct service to the city of Portland. If you look on the left side, that is the budget of our bureau. And you'll see that I think that reflects the work that I just talked about, with the acknowledgement there's a lot of rent and BTS and other overhead that's all in our admin and support. Next slide, please. We have 22 FTE at PBEM, and this pie chart just shows how they're divided also among our programs. Next slide, please. So how are we getting upstream from emergency response? Well, in our planning, we seek to center our plans in service to the frontline communities that we know are always hit first and worst in every disaster. And we believe that by anticipating that and being able to give effective response in communities that see this over and over again, we are reducing the impacts of that trauma and reducing the likelihood of future emergencies. And then in terms of our community programs, I think we have a really innovative curriculum. It is developed in partnership with the communities that we serve, and it focuses on the idea that all households have the capacity to be resilient. The resilience is not something that you buy in a bucket at Costco, but it's something that you build through your own thinking and preparedness, by taking stock of your household, by taking the actions that are within your means to prepare, and also that we become resilient in community by partnering with our neighbors or people in our communities of affiliation. Next slide, please. How do we know that work is working? Well, as I mentioned, we have more than 2,000 active volunteers. We also have a couple hundred that are in class right now. It's our first bilingual English-Spanish student class, and it's been a great experience for us. And there is no end in sight. We have more than 1,500 people that are on our wait list to take a class. 96% of our volunteers stay active year over year, meaning they continue to volunteer and do advanced training. Almost every neighborhood in Portland has a NET team, and we did 9 volunteer deployments last year, and that number includes really big deployments. We ran a shelter at Clackamas Town Center for wildfire evacuees. We are daily providing navigation for folks who are getting their COVID vaccines with our volunteers. We are flagging traffic for people that are getting COVID testing. We're also doing down power line response, severe weather response, and assisting with response to Johnson Creek flooding. Next slide, please.
Ask a question before you move off of that slide.
Sure.
First of all, thank you for stating that Portland has the largest volunteer emergency response program in the United States. I think it's always nice to pause and acknowledge when we're doing things right that really reflect, I think, a core value of participation here in the city. But you mentioned that there's almost 1,700 people on the class waiting list. If one is to sign up, typically how long does it take to go through that wait list before you're certified to be a volunteer?
That's a great question. Well, what we have seen is that it makes a big difference on where we locate our classes. And so we are making an effort to locate our classes in neighborhoods that have low participation in the program. So if your neighborhood needs a net team or needs more volunteers, then you get bumped to the top of the list and we make it convenient for you. And so you probably wouldn't wait very long. If you're in a neighborhood that has a strong program, you get put on the list as a sort of a trainee, and you can start coming to meetings and meet other volunteers, but you could wait a year or more to have a slot to take the class.
Thank you very much. Commissioner Hardesty also has a question.
Thank you, Mayor. I wasn't going to interrupt Jonah's flow, but since we have, I also wanted to just recognize what an incredible job PBEM has done to diversify the volunteers. I remember not too long ago, most of the volunteers were 65 or older, primarily white, primarily retired. And I just want to say that the remarkable job that's been done over the last couple of years to truly reflect our community is just phenomenal. The number of languages that are spoken by the volunteers is just absolutely phenomenal. And this work would not have happened without strong leadership within the Bureau. And so I do want to take the time to really applaud the work of Jana and Mike Myers and the whole leadership team there. And I think it reminded me that just how often we tap into these volunteers when we don't have enough public resources to actually address the severe need that we have in this community. But it also makes me wonder, after all the crises that we're currently experiencing are over, are there opportunities to utilize net volunteers with our houseless community members? Before 2020, I thought sometimes they were underutilized. Of course, 2020, they were extremely overutilized. But as we start planning for the future, especially with so many people on the wait list, I would really like to have a broader conversation about how do we broaden their reach and their opportunities to serve in our community. So thank you.
Thank you, Commissioner Hardesty. And I would just thank you so much for that compliment. And we feel like we have a long way to go to really reflect the diversity of Portland, but we are definitely moving in the right direction. And I would also say that we are very interested in opportunities to, we have so many volunteers, we're actively looking for more opportunities for people to get in their hours and be engaged. And we've already reached out to Portland Street Response to ask how, Portland net volunteers can fit into that as that program scales up, and we'll be involved with the public safety work group to find other opportunities that are like that. I hope there will be. Thank you. I don't want to take up more than my share time though. Next slide, please. So in terms of measures of success, we normally do 100 or more community events a year, mostly in partnership with community-based organizations. We fell down and did only 65 last year, but I'm proud that more than half of them were in communities of disability or in BIPOC communities. And also last year, we launched our first all Portland Spanish-speaking net. We felt like this is a model that we want to also grow in the future, to Commissioner Hardesty's point about diversifying the program, to create opportunities to participate in ways where they can affiliate with their neighborhood, but also that they can be affiliated with the cultural community, and that can be a net team also. So that's an area where we expect to grow. Next slide, please. So increasing effectiveness. I'm not asking for more money, but I will just say as a coordination bureau, how we feel we can always increase effectiveness is by reducing silos in the city, because our work, we're all in this together in an emergency, and as much as we can work that way all the time, it makes us all stronger and makes PBEM's work more effective. We also, as a small bureau, candidly struggle with administrative processes. And so we're grateful for opportunities to simplify those things so we can just put more of our time and effort into our community work. And also, we really support any opportunities to sort of review citywide policies and that will help us reduce barriers to working with community. Because we know that the same processes where we get hung up, how do we hire an intern? How do we do a contract with the community-based organization? Those are also things that are experienced in the community as barriers. And so we always want to support moving past those. Next slide, please. So budget request. We are trying to walk our talk and lead by example in terms of reducing silos. So we are taking a voluntary reduction in our budget. We are reallocating our finance manager position, which was a 1 FTE at PBEM, to support the public safety work group. And in exchange, we expect that we'll continue to work closely with the public safety work group and work more with OMF, because that person will be at OMF, but they will still also be providing some services to PBEM. And that is the end of my presentation. And I would take questions or gratefully pass it to Director Long.
Colleagues, any further?
Oh, sorry, back to Nike. My bad.
Commissioner Mapps has a question first.
Oh, thank you.
Sure. Thank you for this presentation and thank you for the important work you do. I was wondering if you could expand on this reallocation proposal. You're a small bureau to begin with. According to the paperwork I have, 17% of your positions are unfilled. And now you're taking one position out of your bureau and transferring it over to OMF. Just seems counterintuitive to me.
No, I can see that. Well, I would say so. 17% is, I think, 2 positions that are vacant for a bureau of our size. One of them is the finance manager position, which has already been vacant for more than a year. And we've been grateful for the assistance of the budget office and OMF to help us fill the gap. And our feeling is that we can do the work that needs to be done for our own purposes with part of the time of the person that's going to OMF, and also with others within the leadership team at PBEM picking up some of the work, which is more work, but in other ways it will strengthen our bureau for a more leadership team to have a strong understanding of our budget and how it's supporting our strategic goals.
Is there any plan to catch up on the backlog of folks who are waiting in line for training?
Yes, I think that this year has shown us with the online trainings that we can reach more people and also do more bilingual training, so that we don't need to have special like Spanish trainings or special Chinese language trainings, that we can do it all together. So I think that we will still need to do some in-person stuff, first aid. It's hard to practice online, but I think a lot of our work can be moved to Zoom trainings. And also we're doing some training videos so that people can get some background before they come to the classes, and the classes in person can be shorter, so we can be more efficient.
Great, thank you very much.
Thank you.
So I think the next presentation was going to be by Director Green. And Christina, if you wouldn't mind pulling up the presentation again.
Thank you. And as she's pulling up, I will go ahead and dive in. Nike Green, the Director of the Office of Violence Prevention. Our office addresses complex factors that drive violence. Our office uses a public health model and approach to violence prevention. Our office's goal is to elevate the voices of those who are most impacted by gun violence. And we collaborate with our community, with key stakeholders, with faith leaders, community-based organizations, and more, because we know that it is a multidisciplinary approach that requires a multi-sector investment in services and advocacy and in funding. Currently, there is a need for a more strategic alignment in our efforts with sustained investments and actions that will prevent violence, build resiliency, and create a safer Portland. We understand that violence is a virus. And so it can be both treated and prevented when we look through those lenses. And so we're able to look at those root causes, look at risk factors and protective factors. And we're able to do this from a community-based level, looking at the population level and addressing from individual to family to our community to our society. And so, next slide. How do we do that in our office? The program service areas that we have to look at these root causes, to address these with our primary and our secondary preventions, are street level outreach workers. They are what we are, most people know them as violent interrupters or community connectors. They engage with those that are at risk, looking at reducing those risk factors and increasing those protective factors. Individuals' lived experiences, making sure that they reach out to our youth and our young adults to make sure that they have pro-social activities, making sure that they have strong family structures, and interrupting those social determinants that can make one predisposed to violence. Healing hurt people. That is our hospital-based trauma one response team, another evidence-based practice that we utilize in OVP. They are 24/7. We are currently in Emmanuel Hospital. Whenever there is an injury, shooting, or a stabbing and a person of color, we are called and our team shows up there. And what their goal is to reduce recidivism, meaning another hospital visit, being re-victimized by gun violence. And most importantly, not just to reduce retaliation, but we know that within that 4-hour time frame, most decisions are made. And then to reduce the long-term impact of trauma, that we have an individual that is a victim in a bed right now who needs to be able to grieve, to be able to heal, to be able to go into treatment, be able to get into rehab and get what they need to make sure they restore from the trauma, both physically as well as emotionally and mentally. Our second is trauma and violence impacted family. And that's where, as we get referrals and we are making sure that our services are aligned with best practices, as we understand what is going on in the lives of those that are impacted by gun violence, they connect those individuals with support services, with service providers, with our intensive case managers, our life coaches to do case management, to walk alongside of these individuals to make sure that they have what they need to be supported. This is a collaborative effort. It takes downstream when we talk about that secondary prevention. This is where you're going to hear a little bit more of why it's important for those that have the highest risk, that they have people who can walk with them, that are credible messengers, have that lived experience and know what it's going to take to have a pathway towards success. Last is our Portland Restoration Academy. This is an internal program that is housed and we're very, very proud about. When we look at indicators around barriers, again, addressing root causes, we saw a gap in our formerly incarcerated loved ones and family members and community members who, when they return, it's really hard for them to get a job, a life, a sustaining job, a wage that can provide a career. So we just were able to bring in 3 interns, and they're all formerly incarcerated, and they are doing amazing work right now as they finalize what our Restoration Academy is going to look like for the next years to come. Next slide. So I'm going to first just identify, here's what our ask is. We have been doing assessment after assessment. We've been looking at where the gaps are. And so our ask is for 1.6 million for our 21-22. We currently have 3 and so we have, currently have 4 internal FTE, and we're 16 in external. And so go ahead and go to the next slide. So part of what we're measuring for our success is there's this qualitative part, there's a quantitative part, and then there's an impact measure. And I think what I want to lean in before I talk about all of the gaps of service in our current issue is that how we measure our success. Qualitative it's that story. It's the real life issue of the mom whose children are in the hospital. We're sitting in the parking lot of of the Emmanuel Hospital, and we are literally finding ways to get some of our team members to go to her house and clean up the blood. We are making sure that they have access to the hospital. We're making sure we're connecting them with resources immediately. And then when that confirmation comes back around, this is the qualitative, and they say, there was no way we would have made it through without you. Here's the resources we needed. How do we connect with you even more? We needed every part of that. And that's when we galvanize from our outreach workers to our hospital-based trauma team, and then even with our crisis response team and our other community partners who joined in helping that family. I think I'm supposed to pause. I see hands, so am I supposed to pause?
All right. Yeah, if you don't mind, Commissioner Hardesty, then Commissioner.
Sorry.
Thank you.
Thank you. I know I was, Nike, breathe. Director Green, breathe. Yes, yes. Take a breath. Could you go back 1 slide, please? My question is what is the new dollars that are being asked for?
What are the new
I
dollars?
mean,
Oh,
is this all a new dollars or are this additional dollars that are being requested? I'm just trying to figure out what the current budget is as compared to what the fiscal ask is for next year.
correct. So this is our ask for a 21. Am I saying that right, Katie? I want to make sure I'm on the right slide. This is not my, no, this is our current capacity, right? Oops.
That is correct. This is our current requested budget. And the next slide, if she hadn't quite gotten to it yet, shows the ask, the additional ask.
Thank you. That's what I was trying to clarify.
Hello, yeah. Thank you, Nike. Good to see you. Stay on the same slide. Awesome. So I want to make sure I understand the definition of the words internal and external. So to my little brain, when I hear external, it means that there are investments that are outside of the city, working with community partners, perhaps, to do street level outreach, which of course I think is a good idea, probably why I raised my hand, and healing hurt people, etc. But maybe it doesn't mean that. Maybe this means that 16.7 FTE in your office are focused on this. I just don't know.
No. So so the reason I wanted to make sure I pulled out Portland Restoration Academy for specifically around internal externals, because they actually are hired by our office and they're city interns. So that you are correct. The external program is how we are providing grants for our community-based organizations. The internal is our personnel at the top and our training. That's our so we have 4 internal FTE. That's not talking about the interns.
Okay, they're in your operation at the city, the backbone. And then the 16.7 are the investments we have out in the community whom you partner with.
Correct.
Okay, thank you for that clarification.
Commissioner Rubio.
That was also my clarification request as well. So when you're talking about external FTE, you just mean contracts with CBOs that employ their FTE. Okay. And then also, can you talk about how many contracted organizations, and do they all have the same kind of services that they're employing, or are there differentiated services by community, and how much flexibility do they have to do within their contracts to actually use strategies that work in their specific communities?
Yeah, so I can answer the second part, and then I can have Katie jump in on just all of the logistics of all the different contracts. So I'm going to jump ahead now to really answer that question, because I was going to answer that question later, but this is one of the service gaps that we are really looking at addressing when we talk about system change, and we're looking at everyone saying, how do we fill gaps? How do we work smarter and not so hard? And so one of the things that we're doing is, if you notice in this external approach, all we talk about is FTE. We do not talk about program service dollars. And so as we've been doing our assessment, you know, if you don't have program service dollars, how are you going to have a full wraparound service model for these agencies to be able to do a full comprehensive work? And so the flexibility is what we're looking to add on. That's part of our ask, why you will see the addition in FTE. You also see the request in program funding, and allowing more flexibility in the ability to have not just cultural specific responses, but knowing that, you know, they're aligned with evidence-based practices. With that comes, you know, as everybody knows, another level of accountability, another level of evaluation, because we're trying to align our work and we're trying to expand it so that we can make sure that where there's gaps, which we already know, and I'm sorry, I'm going out of my slide order, but what we've identified, the gaps in violence is for, again, disproportionately our Black community, but our African immigrant refugee community and our Latino community. So when we looked at our programs, we had to see, where are we investing and how are we doing this work and how can we do it better? And so that's what we're assessing now. And that's why most of our ask is going to be on the slide that's somewhere in the front, but I'm jumping ahead. Katie, do you want to answer the grant question, I think, that she had?
Can you say what the grant question was that wasn't already answered by what Nike had said, and I can get answering it for you?
I think the question was about how much flexibility do they have, and she answered that that's what they're bringing. But I guess the other part of that question, my question was about services. Like, each contractor, do they have similar services, or are they different based on organization and FTE that they are funded for? And then also, what I'm just going to add on, just because of something you mentioned too, is in this new added on extra or more flexibility funding that you're asking for, did the contractors help to shape what that looks like? Because my concern is about sometimes best practices don't always include all communities. So that's where I'm coming from on that.
So the grant agreements for most of the, or for the SLO workers, sorry, the street level outreach workers, those are, the grant agreements are all about they're all the same for each one of them at this point. We do have, there is a little flexibility within the budgets on each one of those. I can, just we're in the middle of changing them all out right now. Not changing them out, excuse me. Working on those at this point.
So they're at different levels right now of
well, there are amendments that we are able to do amendments to each one of the grant agreements in order to specify for each one of the community-based organizations. Does that answer your question?
I guess I was more curious about, so in my prior life when I was a director, I know that we only had one outreach worker, but other organizations had different, and there was sometimes some variation. So that's where my question is, like, are there differentiated services still and different number of FTE per org, or is the goal get them there and you're not there? It's just helpful for me to see a picture.
Yes, so there are different amounts per organization of street level outreach workers, depending on the needs of the community at the time that the grant was created. Each fiscal year, we relook at those and adjust if needed.
Commissioner Hardesty.
Mayor, I apologize because I know we're going to have to move on, but I'm trying to connect the dots, I think, to the question that Commissioner Rubio asked. So let me ask it another way. How many of the community-based organizations also receive funding from the county for this work? And how is that work coordinated around the outreach? So that's one question. And my final question is, most of these programs are done by a nonprofit community-based organization, and it feels wrong for the city to call them their programs. I mean, we're investing dollars in it, but it's not a city program, it's a community-based program. And so I get concerned when we claim work that the community is the one that's actually doing. So I just wanted to make that statement, but please try to answer the first question. Where's the overlap? Because I know the county funds these services as well through their Department of Justice reinvestment dollars.
So I am not aware of any overlap in the specific lanes that we're in with what the county funds. Whether they have contracts with the county or not, I'm not aware of any in the street level outreach lane or the Healing Hurt People lane, or in our TVIF. We do have collective conversations and communication about different work, but their lanes, as far as I know so far, are different. I do know that there's other outreach happening in different areas, but it doesn't cross over. So That's the best way I can answer that part for you. But yeah, I don't know of any county street level outreach team that's that does the exact same thing that we do.
But the community-based organizations are doing that work in addition to the work they're contracted to do with the city.
Sure. I mean, I'm not a community-based organization, so I'm like, I don't want to answer for all the community-based organizations, but I do believe, yes, that many of the organizations have shared contracts with different funding sources. Absolutely.
So Commissioner Rubio, what was your experience at Latino Network?
Yeah, thank you. I was hoping that maybe I can help explain what Nike's answer is to you a little bit about as a contractor. Sometimes, nonprofit organizations hold different contracts, and this is a different discrete contract. So the idea is hopefully that it's in the same family, so that the same kind of work, so that you can have, if done well, like real good integration because and connection across jurisdictions, so that one is leveraging the other. I mean, that's the idea, I think.
So we should probably move forward because we'll be here all day.
No worries.
Let me just say one of the benefits of these work sessions, we're not necessarily going to get all the answers we want here and now. And it frankly sounds like there's still some confusion on these points that needs to be clarified. So let's also take the opportunity, either directly or through the chat, if there are specific questions that we need the bureaus to follow up on, let's let them know so that they can follow up. And it sounds like this is a pressure point that's going to require some clarification. So Director Green, if you could spend some time on that, we'd appreciate it.
Yeah, so obviously this is way beyond 7 minutes, so I will braze through, which you told me to take a deep breath and slow down, but now that breath is over. So we'll go to the next slide. And some of this I have already covered. This is the increase, which we already know. We can go to the next slide. So this is the actual ask that we have on the table. And they're being very strategic about our ask. It's about filling the gaps. And so when we are asking, and specifically for street level outreach that we just talked about, and for our intensive case managers, we identified again those very specific communities that are not being serviced well right now, and don't have enough funding and resources and investment. That's our African immigrant and refugee community. That's our Latino community, as well as our Black and Brown community in its totality. So not only are we just trying to, I want to be very clear, this is just not about increasing what we already have and making sure it's more effective, but it's also expanding beyond just the same CBOs that we have as well, because we know that there's a lot of great work happening in our community. So that funding is going to allow us to partner with more organizations as well as the ones that are currently doing some amazing work. And the intensive case managers are for our more direct intensive case 18-month. And so we want to make sure that they have that trauma-informed care. We want to make sure that they have the ability to have a relocation, a life plan, and making sure that we're really doing evidence-based practices. And so this is where the really hardcore work comes on, where we're working with the highest risk. And I see Mingus Maps. I will stop again.
Commissioner Maps.
Thank you. Can you explain to me the relationship between these numbers and the slide 2 slides back, which we spent a lot of time on, the FY22 requested budget?
The difference between this current slide and the one we were just looking at?
Yeah.
Yeah, so that's our base budget. That's what we're working off of now. We're asking for, in addition to our regular budget, this is our additional ask. We're asking for an additional 10 on top of what we already have externally, and additional 3 to our 4 internally.
Okay.
What's also in, go ahead.
Nope, continue.
Yeah, what's also in here, and yes, I think Commissioner Rubio, I've apologized. I don't think I actually answered that question. So in our quarterly reports, as well as in other meetings, what we have been getting is feedback continuously. We also are having rounds going now where our program manager is talking to all of our CBOs and their supervisors, and we're getting on the ground constant feedback of what they need, what would be more effective, how could they could do their work better. And so that is informing all of our work, and it's informing our 21-22 contracts and how we move forward. So we're not doing this in a silo. We also are aligning that with evidence-based practices so that we can make sure that we are able to actually have the desired outcomes that we have.
Okay, I think I still have some questions, but I'll follow up with you later.
Awesome. So that is our last slide of our request. I just want to really reiterate how important it is to invest in prevention and intervention, and that we are already making this investment. I want you to know that all of our asks are aligned with where there's service gaps and where those communities are most impacted. And it is really essential for us to make sure that we do things differently. I know that many of the things that we have looked at in the past, we are now taking all that information so that we can move forward and we can have more of a collective approach that is effective, that really meets our community where they're at. And they need us to show up in a way that we have never showed up before. And our office is making those adjustments, and we're expanding in ways that we hope that you will support and invest in on the Office of Violence Prevention. But more so, you're investing in our community and those amazing community organizations that do some amazing work. So thank you. I'm now going to hand it off to.
Before you do that, I just want to encourage any of our budget advisors, if any of you have any questions, as always, Show or anybody else, if you want to jump in here. Frida, I see you've got your hand raised. Go for it.
It was when she was talking about trauma, it made me think of it. Is it strictly the victim and the victim's family you work with? I happen to know a young Latino person who last year witnessed a murder, which was very traumatizing and eventually had medical impact on her. So I was just kind of curious, is it just the victim and the victim's family you work with, or are you planning to expand farther for situations like that?
So we get many referrals all wrapped around community violence, and what we do is that goes through our trauma and our violence impacted program, and they will make an assessment, and we will either connect that individual with an outreach worker, or we will make sure that we connect them directly with our county partners and their behavioral health team and some of their response teams.
Where would, if a situation ends up like that, how would they know where to contact? Because this person didn't and struggled. So I'm just kind of curious. I like to let people know when there's resources out there.
Yeah, they can contact our office directly. We get referrals from all over. We get referrals through the school district, through family members, through our actual shared organizations, through Healing Hurt People, through our county partners. Our referrals come from all over. So they could basically reach out to our office directly, and then we'll take them through that process so that we can make sure that they're connected.
Okay, thank you.
All right, thanks. Let's move along, Jessica. Director Kennard.
Sure. So I think we are now going to Director Long to talk about the Parks Ranger program. If we could pull up the presentation again.
Welcome.
Good afternoon, Mayor Wheeler, Commissioners Hardesty, Maps, Rubio, and Ryan. For the record, my name is Adina Long, and I am the Director of Portland Parks and Recreation. Joining me today is Vicente Harrison, Security and Emergency Manager for Portland Parks and Recreation. Thank you for this opportunity to review community safety services in our city, one of which is our Park Ranger program. The Park Ranger program began in its current form in 2014 and has undergone tremendous growth in just 7 years. As you all know, Portland Parks and Recreation delivers services and programs to create, care for, and program accessible park spaces and places that contribute to community wellness, environmental health, youth development, social connection, nature exploration, cultural enrichment, and learning, to name but a few. The Park Ranger program is another crucial element of the Bureau's work. Park rangers are essential to keeping our developed parks, natural areas, and park facilities welcoming, activated, safe, and enjoyable for all Portlanders and visitors. In short, park rangers serve as ambassadors of Portland's vast and beloved parks and recreation system. Our presentation today provides an overview of the services rangers provide, their metrics, and how they're collaborating with the community and other City Bureau partners. I'm going to pass it to Vicente now.
Good afternoon, everyone. Thank you, Director Long, as well as our fellow presenting Bureau colleagues. Good afternoon, Mayor Wheeler and City Council. My name is Vicente Harrison. I have served as a park ranger, supervisor, security manager, and now security and emergency manager for Portland Parks and Recreation. Thank you all again for this opportunity to review additional community safety initiatives happening in our city, one of which is our Park Ranger program. The Park Ranger program began in its current form in 2014 and has undergone tremendous growth in just short 7 years, as Adina mentioned. As you may know, Portland Parks provides services and programs to activate and create positive spaces in parks like summer free-for-all, summer concerts, free lunch and play, and more. The Park Ranger program and other elements of our programs that is essential to keeping parks and natural areas positive, activated, safe, and enjoyable for all Portlanders and visitors. Our presentation today reviews the services rangers provide, again, our metrics, how we're collaborating, and community and City of Portland partners, how we're collaborating with City of Portland partners. Next slide, please. The Park Ranger program is made up of a diverse group of 24 full-time ranger staff, 1 parking enforcement officer, mainly focused on Washington Park, and 1 supervisor and security manager, who is Sophia Xavier. We are also employ about 15 seasonal staff during our peak and summer season, normally from late April through early September. Park rangers patrol 7 days a week, including night and graveyard shift, which rangers cover nearly 12,000 acres. Next slide, please. The Park Ranger program promotes community safety by using a framework that encourages resource protection, community engagement, and park community safety. Community safety in parks, natural areas, and community centers is promoted by park rangers primarily through proactive, positive education engagement. Rangers respond to civil, behavioral, and societal issues that affect park visitors and resources. Because rangers are not sworn officers nor law enforcement, they use enforcement tools like civil penalties to resolve park problems. Crimes in parks remains the core responsibility of Portland Police Bureau. Park rangers seek voluntary compliance whenever possible and use the least amount of intervention necessary to resolve park safety and rule issues. Next slide, please. Park ranger enhance visitor experience in parks by protecting both tangible physical assets and parks' intangible moments that happen in parks. Rangers problem solve with visitors in a way that helps instill trust, respect for our parks and natural areas and park system resources. We aim to support the visitor experience by building trust with the community and cultivating shared respect for parks and the park experience for all Portlanders. Next slide, please. The Park Ranger program proactively supports the community during times of emergency and everyday use in our parks. For example, during the COVID-19 response, Park Rangers partnered with the Office of Violence Prevention and Portland Bureau of Emergency Management, also local community groups at Dawson Park, where we routinely went out with and handed out masks, sanitizer, and water to engage the community and remind patrons of the importance of staying safe and following public health protocols. During this past year's wildfire emergency, park rangers and Portland Fire, as well as other community partners, teamed up to ensure people living outside and near parks were moved to safer shelter. As park rangers actively coordinate as a referral contact for Portlanders experiencing homelessness so they can obtain essential social services from various partners. The program also continues to build its Leave No Trace partnership with the Leave No Trace Center for Outdoor Ethics and have developed urban park principles for Portland city parks. Next slide, please. Finally, the Rangers provide a park safety presence wherever we go. As mentioned, our toolkit resolving park problems begins with engagement and education. When needed, our next step in enforcement is civil and non-punitive, using written warnings, exclusions, or civil penalties in limited cases. We handle as much in-house as possible when the park problems is not a criminal act. Next slide, please. Rangers strive to create a welcoming park system for all Portlanders. Part of that success is seen here. Rangers made over 37,000 positive and educational contacts in parks in 2020. In addition, Rangers also removed over 600 physical hazards in parks during 2020. This includes things like needles, liquor bottle and other paraphernalia, dangerous debris, and other items that impact visitor experience. There are times cooperation can't be achieved, so written warnings or park exclusions are issued. In 2020, Rangers resorted to paperwork just 59 times when voluntary compliance could not be generated. Next slide, please. Success for the Park Ranger program is measured in 3 ways. The first is the annual Portland Community Insight Survey. The latest survey points that in 2019, it asked Portlanders how satisfied they were about safety in parks and natural areas they visited. 69% of respondents indicated that they were somewhat or strongly satisfied with park safety. This sense of safety drops for responders east of 205. So the Bureau continues to evaluate and appropriate markers to attain for this data point. The second way we measured the program is through how many community members are calling us. Since 2014, the number of calls for service has increased year over year, peaking in 2018 at 5,800 calls that year. Unfortunately, due to budget constraints, our weekend call taking position was eliminated in 2019. So our calls for service numbers have dipped since that time. Next slide, please. And again, lastly, we measure performance through periodic reviews of where we're patrolling, the number of hours we're spending in those areas, and the type of engagement that we're doing. In a moment, we'll discuss our challenges, one of which is having more real-time and transparent data about where and how Rangers are spending time so that we can make more careful prioritized services, adjust patrol and engagement strategies, and improve overall engagement, resource protection, and park safety metrics. Next slide, please. Now, again, one of our first challenges I'd like to identify, we have 2 key challenges in the Park Ranger program that we are working to resolve. The first is our general program infrastructure, which has not kept pace with the growing demands for service. As a part of the Parks Levy approved by Council, thank you, the program can now provide a dedicated 7-day-a-week call-taking coverage for this summer. We are also in the process of developing a digital records management system that will allow us to track Rangers' response, patrol, and engagement more closely in a real-time manner for improved program management. We will also be adding positions through field supervisors, additional seasonal staff for the upcoming summer season, as well as additional resources for training. Next slide, please. The second challenge we face is solidifying our identity, culture, and training for the program. The Ranger program is a unique model that relies on Rangers having a specific set of skills, confidence, and tact to gain voluntary compliance and prevent escalating of community safety challenges. We are undergoing a strategic plan process currently that outlines these frameworks. We want to implement new standards of training and use our records management system to bolster our program. Finally, we want to continue to improve the Park Ranger program. We'll need to ensure that the levels of service and core roles and responsibilities requested by the community is supported with the proper level of investment into the program. And I believe that's our final slide. We can answer any questions on what we've presented thus far.
Commissioner Hardesty. Everybody has questions.
Thank you for that incredible presentation. And Mr. Harris, let me say that it sounds like you have been with the Park Ranger program since its inception, because you've had pretty much every role inside the program, and we're lucky to have you. So my question was about the investments that you want to make moving forward. And are those investments that are coming out of the levy that was recently passed, or is there a general fund ask?
Those are requests that are coming out of the levy that has been recently asked. Those are what we're planning to install into the program from the levy.
I'm happy to hear that. Thank you.
Commissioner Ryan.
Oh, yes, thank you. Thank you, Vicente. That was a great presentation. The slide that you showed where you did the survey and there was 69% were favorable, or do you remember that slide is the one I'm talking about? That was in 2018 or 2019, correct?
I believe it was 2018.
Okay. Is there
2019.
Okay, so it's recent. My point is, it's always nice to see trends. Did this similar survey go out, say, a few years earlier, and did it look different? Or did Director Long bring such insight as a leader, and so we asked this question when she arrived?
That's a great question, Commissioner Ryan. My understanding is that the Community Insight Survey happens every 2 years, and please, anyone jump in if I'm incorrect there. And we actually slightly changed the question format, which unfortunately, I mean, we got better, more accurate information, but it caused us to not be able to compare apples to apples and oranges to oranges. Yeah. So the data is a little bit skewed, but we are happy to share with you other survey results that we've had in the past.
I appreciate that, Director Long. I know how important it is to adjust your questions, and so the goalposts move, if you will. That said, it's still, there's probably a way to look at past surveys to see if the trend lines went a certain direction.
I can say anecdotally that in general, folks are feeling less safe in our parks. And I don't think that would come as a surprise to anyone.
Not at all. And I think that's where I was curious, because anecdotally, I hear the same thing. And anyway, great presentation. I appreciate the insight. And it's just always nice to see the data like that. Appreciate it.
Commissioner Rubio.
Thank you, Vicente, for that presentation. It's great to hear about this again and know another layer deeper in this work. My question is about the recent incidents of violence in the park. How has the Park Ranger program, responded? How are you working to prevent? And when these incidents happen, what are you doing on the preventative end?
Commissioner, this is Adina. I'll start off, and then if I miss anything, we'll ask Vicente to jump in, if that's okay. So when there's a violent incident in parks, park rangers are dispatched to respond to the park, and as appropriate, they coordinate with the community, the Office of Violence Prevention, and PPB. Rangers generally follow up with patrols to the area, and our park security leadership, Vicente or Sophia, generally attend community meetings to address public concerns and provide support with any resources that we have available. So in addition to the Park Ranger program, the Bureau also prioritizes programs and services that promote healthy, welcoming, and safe activities in our parks and community centers. And those also support violence prevention. For example, when we design and construct parks, we generally always ask for community's input. And we often include CPTED principles, that stands for Crime Prevention Through Environmental Design. And some of those design elements may include things like additional park lighting, opening up sight lines, or even strategically planting plant material, to name a few things. We also include other amenities like sport courts and fields and playgrounds that promote positive activities and engagement. Another piece that's important is our other programming. We operate programs that support youth development, such as Park Squad, Teen Force, Sun Community Schools, Teen Nature Team, and environmental internship programs. So not only do these programs support young adults through education, employment, and enrichment, they also provide safe and welcoming spaces with supervised mentorship, and they serve to deter potential negative activity.
Thank you. And just one follow-up to that, how do people reach the park rangers for assistance when they need it?
I'm going to punt that to my colleague, Sophia, or to Vicente.
Sophia.
Hi, yeah, so right now what we do, how people come to how do people get to us is the Rangers' current model is a blend of proactive patrols in parks and natural areas and responding to calls for service. So the calls for service rely on park visitors calling the park ranger number, which is 503-823-1637. And that number is answered by PP&R's customer service center. So with the Parks Levy, we will be able to provide dedicated 7-day-a-week answering point for the Park Ranger program. So that'll be really helpful to answering more calls. And also we are looking forward to engaging in discussions to investigate how the 311 system can integrate with the Park Ranger program.
Commissioner Maps.
Thank you, Mr. Mayor, and thanks to Parks for this great presentation and the important work that the Rangers do. I get the impression today you're not making an ask to the general fund. Still, I'd be interested in having a little bit of information about how much this program costs, what are your FTEs like, and it's a relatively new program. I'd be interested in trends in terms of funding and FTEs. It doesn't have to be long, but I have no idea how big or small this thing is.
I can give you a quick snapshot, Commissioner Maps. So our total fiscal year budget is $3.1 million. Per ranger, we have 24 full-time rangers. That's about $100,000 per full-time staff. In terms of just our snapshot demographics, out of those 24, we have 18 male rangers. We have 9 female full-time rangers. 7 of those are BIPOC staff. And in leadership, we have three males in leadership. We have 2 females in leadership, 4 of which are BIPOC staff. So that's just, again, a snapshot. We can provide more detailed information in terms of the funding trend over the year of the program in a follow-up.
Okay, thank you very much.
So I've got a couple of just quick questions. And first of all, Vicente, thank you for the great work you and your team do. And as you know, historically, I've been very supportive of the Ranger program. I think a follow-up question I don't think it's one you can answer today, but it's an important one for me, which is understanding the various lanes. Who's responsible for what in the park? And with street response coming on, we're going to have street response, we're going to have the rangers, we're going to have other teams that you've engaged, and we have the police bureau. And I'm curious to know how the decision gets made about how to allocate calls to those various entities that could be called upon. So that's just sort of a general something I'd like to put into the parking lot for later. Second of all, your data, 30%, another way to look at this is 30% of the people who are surveyed do not feel safe in our parks. And so I guess my question is, how do we decide what success is? And I'm guessing 30% probably isn't very different from parks in other cities. I would love to have a gender breakdown on that if that is possible. And let's just call a spade a spade. Our country is awash in male perpetrated violence right now. And I wonder if that 30% is disproportionately women, females. And if so, have we really done the outreach to find what it would take for people to feel more safe? It's a shame to me that 30% of the people surveyed don't feel comfortable in what I think is one of the best park systems in the entire United States, objectively. So I'd like us to focus a little more on that. You mentioned a significant increase in calls. And I have two questions. Number one, and Commissioner Rubio started to get at this, and it's prompted maybe a different question for me, or a slightly different question. How do people know who to call when, are these calls that all came to the parks rangers, or were they referred by BOIC? How do you get the calls, first of all? And second of all, to what do you attribute the increase in calls?
So again, we're going to follow up with the first question, a series of questions you ask in writing. But in terms of our increase for calls for service, it was initially, again, the program has grown very quickly over the 7 years, and we didn't have 7-day-a-week call service, nor as many rangers. So once people got the word that the ranger program was out and we started servicing East Portland, as well as other demographic areas in the city when we were much smaller, we couldn't get to, of course, the demand for, okay, we have rangers, we want people to come out and service those areas. I think another attribute, before I pass it to Sophia and or Adina to add anything, is the city core values of communication and collaboration is again with our partners that we presented with today. Once we have increased our communication with partner agencies, we did get referrals from existing bureaus that know the work that we're doing, and we begin to collaborate more. So all of the calls came through our customer service center. So all of the calls came directly with us. But again, the word spreads quickly once we began to collaborate more and communicate more with our partners, which helped increase, the demand for service. So I don't know if Sophia or Adina had anything else to add.
I was just going to add that the customer service phone number is fairly well published in literature and on signage. So I think that is helpful for folks when they're out in a park and something happens and they report it immediately. And of course, the website, a lot of folks know to get on the website and to figure out how to report a complaint or a concern.
And Director Long, do you have a sense of what the increase in calls is related to? Is it just better publicity about the number? Is that?
I think the increase in calls is because people are more aware, right? Also because we are responsive, right? So they don't feel like their call is a dead end. We actually go out and follow up, and the rangers are really great at that. But I also think there's an increase in calls because our parks are just being used so well. I always say they're being loved to death, and which is a great problem to have. But also, we are, as you well know, all dealing with extreme livability issues, and that does not stop as you cross the park threshold. And so, I think there's an increase in calls because people are using the parks a lot more for good or for bad. And then that's the reason why we're getting an increase in calls.
Okay, very good. And last, and then I'll stop here. This has been a good presentation and I appreciate it. I assume as you consider the increase in staffing that it's being allocated based on what you think the changing dynamics or changing needs in the parks are.
I'm not really sure. I missed how that was a question. Can you state it again?
Yeah, sorry, I sort of stuck the verb at the end of the sentence. It's been a long week, folks. You're asking for additional FTE, additional support for the Ranger program. Are you allocating that additional FTE capacity specific to the changing needs or the changing dynamics in the park, or are you simply asking for additional general help?
We're actually not asking for any general fund in this requested budget, right? It's the increased capacity is going to come through the levy funding, and it's because we actually cut a dispatch role previously, and that's one of the reasons why we want to make sure that we have 7-day-a-week coverage so that when the public does call, we're able to dispatch rangers 7 days a week. So that's one reason. The other reason is, and again, a great problem to have, is that we just need additional supervisors. We have a swing shift. We've been able to, we want to make sure that we can continue to support longer hours, 7-day-a-week operations. So it's a dispatcher, supervisor, and we're increasing some seasonal ranger positions. So because most people are in our parks, spring through fall. So.
That's helpful. Thank you, Director. I appreciate it.
Thank you. Thanks, everyone.
So I think at this time, if folks have additional questions, please do put them in the chat. We'll facilitate responses and follow up. This is a really important and engaging conversation. I do want to transition to a break. Let's go ahead and take a break until 2:50, at which point we will come back and focus on our first responders.
Excellent. We're in recess till 2:50. why don't we go ahead and continue?
All right. We are now transitioning to a portion more focused on folks that are more closely engaged in first response. And I believe we will begin with the Bureau of Emergency Communications. And I believe that the Office of Management and Finance has helped construct the group presentation and will be helping with driving. So I think Julian, if you are on and able to pull up, fantastic, thank you. We'll turn it over to, I believe, Director Cosby.
Good afternoon, Mayor and Commissioners and members of the Budget Committee. I'm Bob Causey, Director of the Bureau of Emergency Communications. We're also known as BOEC or BOEC, so you may hear that term throughout the presentation. And I'd like to thank you for the opportunity to be here today to kick off Community Safety as a System collaborative budget presentation. I'm also joined by Portland Fire Chief Boone, Portland Street Response Program Manager Robin Burek, and Portland Police Chief Lavelle. We're here today to not only outline our budget needs and requests, but also to demonstrate how interwoven we are in providing service to our community. Next slide, please. To kick things off with BOEC, our mission is to ensure effective and timely 911 call answering and dispatching. And through that mission, we partner with other public safety bureaus and agencies throughout Multnomah County. BOEC answers 911 emergency and non-emergency and administrative calls from across Multnomah County. Emergency calls are prioritized and our civilian call takers answer the phones. If a caller has a non-emergency need for information or a referral, the call is transferred to the appropriate outside agency. When a caller is reporting a need for public safety assistance, the call taker then enters pertinent information into our computer dispatch system, so a dispatcher can send appropriate help, fire and medical assistance, Portland Street Response, or police. Next slide, please. BOEC spends just over 70% of expenses on personnel costs and around 26% on internal and external materials and services. Next slide, please. Over the past 3 years, BOEC has been making substantial progress on our 5-year strategic plan. And today I'll provide an update on 4 of our 10 existing strategic initiatives. Next slide. Initiative number 1 is our strategy to answer 911 calls as quickly as possible. During 2020, we answered over 526,000 911 calls and nearly the same in administrative and non-emergency calls. Our goal is to answer 911 calls within 15 seconds, and we have 3 approaches to help us get there. A few years ago, we discontinued technology that slowed us down, honestly. Namely, a system that was intended to reduce accidental 911 calls from cell phones, but rather it slowed down our process by incorporating a lengthy and confusing recording that delayed our response. We turned that off. And currently, we're adding alternate shift schedules to better staff our center during times of high call volume. And our next step is to staff up so that we're able to provide the timely service that our community expects. Next slide, please. Our second initiative pertains to triaging calls. On May 4th of this year, we will be implementing our medical and fire integrated call answering system. This is known as ProQA, or Professional Quality Assurance, which integrates our call answering protocol into our computer dispatch system. This will allow a more seamless, consistent, and efficient call processing approach for medical and fire calls. As listed in our strategic plan, about a year from now, we hope to have a framework or an outline developed to guide us toward implementing a nurse triage program. Nurse triage program purpose is to reduce overcrowding at emergency departments and provide care instructions and medical care alternatives in appropriate situations. Many people call 911 for medical or trauma conditions that could be more appropriately cared for in ways other than an ambulance trip to an emergency department, which can be very expensive even for minor incidents, especially for people without insurance or with poor insurance coverage. The 911 nurse triage program would help navigate callers with minor medical conditions to urgent care, their primary care physician, or even self-care at home. 911 requests would initially be categorized by one of our certified emergency medical dispatch call takers using the ProQA system that I mentioned before. Minor situations that meet the specific criteria would then be transferred to the emergency communications nurse. That nurse then uses their education and experience with the support of an integrated computer system to more fully assess the patient's condition and determine a more appropriate response. And finally, the third component is a goal of implementing police integrated call answering protocol. Through that same ProQA system, at that point, we'll have a full complement of integrated call answering protocol for every service that we provide. We're looking 2 years down the road for that to occur. Next slide, please. Our third initiative is our equity initiative. Over the past year, we've established our Bureau Equity Committee, which helped develop an equity budget. We're also promoting racial equity awareness and reviewing policies using the results-based accountability model that I and many of my colleagues in the city have learned. In conjunction with a leadership development initiative that's also in our BOEC strategy, we're also incorporating components from that initiative to ensure that our BIPOC employees receive the growth opportunities that they deserve. And the last initiative I'd like to discuss is the importance of having, next slide, please. The importance of having an efficient, resilient, and adequately backed up 911 emergency communications center. We're currently developing a capital replacement and facility upgrade plan, and we participated in the city's long-range facilities master study. Next slide, please. And that brings us to our key challenges and risks. In the city's long-range plan, BOEC was rated in poor condition and received a good function rating. That means that while our facility is in poor shape, we're making the best of what we have. The most concerning news, though, is that BOEC's backup facility, which is a trailer, received poor ratings in both categories. The fact is the trailer is completely inadequate to use during a pandemic. It's far too small, and it doesn't even have restroom facilities. Furthermore, it's housed in a non-seismic garage, and in the event of a seismic activity, an earthquake, it would really be unusable. This is a problem that needs to be addressed as soon as possible, and I look forward to working with the city's new Public Safety Transition Director to help us solve this dilemma. I'd like to congratulate Director Myers in that appointment. In addition to our capital needs, because our budget is based on a population model, the city of Portland contributes about 80% of our funding. And our partner agencies, such as Multnomah County, Gresham, Troutdale, et cetera, make up the remaining 20%. What this means is that cuts to city revenue translates to cuts to our user agency revenue also. And regarding operations, continually increasing calls to 911 and administrative lines has had an impact on our staff stress levels and burnout. In addition to all this, we also need to create a mechanism to stay ahead of anticipated attrition. Next slide, please. This leads us to 2 requests. This year, we're requesting 5 call answering and dispatch personnel to help us meet staffing expectations for Portland street response and to help improve our 911 call answering times. We're also asking for 3 call answering and dispatch limited term positions to build a training pipeline to help us stay ahead of attrition. Both of these requests are funded by an anticipated increase in 911 tax revenue from the state. That's my presentation. Thank you for allowing me this opportunity to provide this information. Are there any questions?
Colleagues? Looks like you're getting off the hook for now, Bob.
Wow. Well, now, thank you.
Oh, wait, Commissioner Ryan's coming back. Here he is. Commissioner Ryan.
Yeah, thank you. Thank you, Bob. I just want to understand why we're here. If you could educate me on the 911 revenue stream you mentioned from the state. What is that looking like? And do we have it as a targeted investment for our own 911?
Yeah, we do. In fact, state law requires that we use the funding for 911 purposes only. And for BOEC, we use that money to fund our call taking personnel, and which is why this ties into our request for 5 FTE as well as the 3 limited term positions.
So you're not asking for anything outside of that?
That's correct.
Okay, that was really clear. Thank you, Bob. Appreciate it.
And now I'd like to pass this
Wait,
on
wait,
to.
Not so
Oh, I'm
fast.
sorry.
Commissioner Maps.
Sure. Hi, Director Causey. I was going to let you stay off the hook, but as long as we had a question and the dam has been breached, I want to pick up on a theme that the mayor asked earlier when he was querying the Parks Rangers program. That how do you get those folks out? How do you get rangers on the scene? And specifically, the thing I'm curious about is the interaction and relationship between 911 and 311, and what the future of that looks like.
Yeah, if you remember the, I think it was the 3rd slide in the presentation, has the outline of how calls come into BOEC. Our call takers or civilian call takers, they answer the phone, but it's the same people who are answering 911 and the administrative or non-emergency lines. When it's an administrative call or a referral call, we send those off. And I mentioned that pretty briefly, but many of those calls would go to what we used to call information and referral. Yep. It's also the 311 program. And we would pass those calls on to 311. What I'd like to see is a mechanism in place to prevent the calls, those types of calls that are referrals or the non-emergencies, prevent them from coming to us to begin with. Mm-hmm. We're the Bureau of Emergency Communications, not the Bureau of Non-Emergency Communications. And I'd like us to be able to focus on what we're really good at, and that really is emergencies. So being able to not only educate the community on when it's appropriate to call 911 versus 311, but having a 311 program in place that really can handle that level of calls. The staffing model that I have in mind to get us to being able to meet those national standards that are referenced in the presentation really hinges on us being able to offload about half or so of our non-emergency calls. And then we'd be able to focus more readily on 911 calls.
Can you quickly remind us how many non-emergency calls our 911 operators are taking now? And also, is 311 ready to take on these calls that we're getting, but really they should be handling?
Yeah, we answer about 500,000 administrative or non-emergency calls a year. And a 311 program, we've been in multiple meetings with them trying to figure out what the next steps need to be. And I know Michelle Koenig North is able to answer their ability to be able to handle some of those calls now.
All right, thank you very much.
Thank you.
Commissioner Hardesty.
Thank you, Mayor. Thank you, Bob Kazi. I miss you in my portfolio, let me just say.
Thank you, Commissioner.
Over the last year, I know that there's been a huge increase in calls around domestic violence. What are the other trends that you're seeing as far as what are people asking for when they're calling 911? That you can highlight for us today? I'm sorry.
Yeah, that's a really good question. I don't track all of the calls for service, but one thing I have tracked through the pandemic is our domestic violence calls. And domestic violence on any given week, when I do a comparison from the same week in the previous year, there's a drastic increase in domestic violence calls, sometimes a 300% increase. It really depends on the week. One thing that I've found fascinating is we also have been tracking suicide-related calls. And believe it or not, those have stayed pretty stable, or in some cases have even decreased. But it really is the domestic violence calls that have increased very drastically.
Thank you. And that just reminds me, Bob, if you could continue to send me those numbers when it's convenient, it would be really helpful. As I serve on the Gateway Domestic Violence Board, I'm the co-chair. So those numbers really help inform the work that we do. Thank you.
Absolutely. I'll get them to you. Thank you.
Very good. Thank you. Appreciate it.
All right. Now I'd like to pass it on to Chief Bill. Thank you.
Got it. Well done. Well earned.
Thank you, Director Kazi. Good afternoon, Mayor Wheeler, City Council, and members of the Budget Committee. Before I start this session and the slide deck, I just want to give pause for a second and let everybody know we had a member from our Budget Advisory Committee who our firefighters responded to on last night. And so when we talk about the critical nature of 911 and an emergency call and dispatch and intervention and rapid transport to the hospital, to where the outcomes, decisions are made, where the outcome are between life and death. And so I just want to hold this BAC member in this space for just a minute before I proceed. The other thing I want to acknowledge when it comes to the 911 system and when it comes to first responders, same as communities that are on the front line, we all experience trauma every day. This is what we see. And we respond on our friends, our family, and we have to compartmentalize in order to do the job. That takes skill, that takes training, that takes competency in order to make quick decisions under extreme pressure. Because the one thing we don't have is time. And so as we look at this system, and I too want to congratulate Director Myers, who was the previous fire chief and understood just the fragility of where we are today, where community members are not having their basic needs met. When it comes to a vulnerable population who hasn't been well served. And then when it comes to critical calls where we're not meeting our response time, it really is a joint effort and a collaboration to look across the entire system and finding these efficiencies. And so when we have someone like Director Myers that has previous experience, understands community safety from the emergency management side, response safety from the responders that have to go into the hazard zone, when it comes to dispatching, and then it comes to innovative programs in order to really look across this system to serve everyone's needs in a growing city. So thank you for at least letting me use that as my opener. It's the only way when we humanize the numbers and the statistics, there's real lives behind the people we respond to save lives. Next slide, please. Our mission is to protect communities through a combination of prevention, community health programs, and all hazard response to fire, medical, natural disasters, and other emergencies. When incidents happen, we must ensure the safety of our workforce, the responsiveness of our system, and the effectiveness of our mitigation efforts. At the same time, we work upstream with programs and in partnership through collaboration with other bureaus, governmental agencies, nonprofits, and community-based organizations to address the needs of our most vulnerable community members and are intentional about how we deploy our resources to best meet everyone's needs. In early 2020, when everything shut down due to the global pandemic, we were on the front line serving our communities. We partnered with Multnomah County Aging, Disability, and Veteran Services to create Meds on Wheels, which ensured high-risk vulnerable populations received life-sustaining medication without risking their exposure going outside and being exposed to COVID-19. As we came to grips with the fact that COVID-19 was killing BIPOC community members at a disproportionate rate, we worked with the county and community-based organizations to improve access to COVID testing. Then we pivoted, using the same platform to administer vaccinations. To date, we have vaccinated over 7,800 community members, as well as 1,700 individuals working in public safety. While realigning resources to save lives during the pandemic, we also provided medical aid for community members marching for social justice and anti-racism. Throughout the year, we mobilized to meet an unprecedented wildfire season, deploying resources 11 times across the state. These responsibilities were in addition to maintaining our core services and coverage. Next slide, please. None of these crises absolves Portland Fire and Rescue from maintaining citywide coverage and providing an effective emergency response to fires, medical emergencies, and other hazards. As first responders, we're a workforce trained and equipped to go into environments that are immediately dangerous to life and health. These environments include toxic, flammable, combustible, and explosive atmospheres. And as you can see with this slide, it's just a myriad of some things that we are trained to mitigate. Trench collapse, fire beyond the room of fire spreading beyond the room of origin. This is a MAX train in a vehicle accident, extrication. There's a lot of specialty tools and equipment that firefighters use because we see the worst. And then we have to figure it out. How to unwrap a car around the human body. That's a skill set. That takes training. That takes support. And that takes a level of protection. We are an all hazards bureau. We have moved from interior structural firefighting and had to train as wildland urban interface firefighters. This city has a lot of risk. And so when we talk about community safety, what is the risk to the population? What is the risk to the property? Portland is the center and the hub of commerce and tourism and transportation. People come from all over the world here. We have hospital systems, we have energy systems, we have 2 rivers, mortgages, marinas, schools, institutions. There is a lot of risk, and we have to be ready for it and trained. The original intent of the 911 system was to immediately dispatch calls, which sets in motion a rapid response and intervention and either transport when time is of the essence. This critical infrastructure provides coverage 24 hours a day, 7 days a week, 365 days a year, and citywide. Next slide, please. This is the geographical area of the city of Portland. It is a population just over 643,000 and growing. When you look at Multnomah County, it's even larger. But our geographic response area hasn't expanded. Density, urban infill. We have emergencies across every part of Portland. And so the blue dots just are a visualization of the fires, rescues, and extrications to where we look at high priority calls requiring a minimum of 4-person crew with specialty training, tools, equipment, and apparatus. Next slide, please. We also overlay, I'm sorry, can you go back one more? We also overlay on top of the fire, rescue, and extrication calls. Now we layer on top the emergency medical calls. So we are highly trained when it comes to fire, rescue, extrication, but also the medical component. And again, it takes this network to ensure that we can scale up and meet the demands when it comes to the 911 system. Next slide, please. Portland Fire and Rescue has 31 fire stations. The city of Portland has 31 fire stations. They're strategically located across the city to provide immediate response to every neighborhood. We also know with the increased demand, as Director Kazi has talked about, not just high priority calls that require 4-person response, highly trained and skilled crews that go into hazardous situations, but we also know when it comes to a lot of calls that are not acute, not emergency, but someone just needs help. That demand is huge. And so in order to find efficiencies within this system, we put rapid response vehicles in service to meet the increased demand. And where you'll see the highest run volume in our city is on the east side. And we have companies going over 3,000 calls a year, sometimes 4,000. And so this really goes to, it's a fluid system, but at the same time, the RRVs are going on calls when it comes to where you can send 2 people as a more appropriate resource. And that allows our engines, trucks, 4-person crews to respond on higher acuity calls, or at least to be available. So I'm going to give you a visual representation to see how this system works, because it's not static, it's very fluid. Next slide, please. This is a typical day, just like today. This was January 12th, 2021, earlier this year. As you can see, all the blue areas are fire companies, fire management companies, FMAs that are available and ready to respond. The orange areas are fire companies that are unavailable because they're already on scene of a call, of an emergency call. So this is at 3:40 in the afternoon. Next slide, please. 8 minutes later, BOAC dispatches an apartment fire. This requires more resources because it's high loss of life, a lot of different functions and tasks that have to be completed. And so we send 4 engines, 2 trucks, and 2 battalion chiefs. First due company arrives within 4 minutes and 52 seconds. Next slide, please. 12 minutes later, you have 5 additional EMS calls that require a 4-person response that we have to be readily available to respond to. So the city, where it seems like it's really protected with companies in service, within 12 minutes, you've had an apartment fire, and this fire displaced 22 families because the fire extended beyond the room of origin. But simultaneously, we had 5 additional medical calls. So we have to scale up to meet the demands any second, any minute of the day. Next slide, please. At 5 o'clock, 5:20, we had a second fire breakout. So while we have a 3rd alarm apartment fire going on in Northeast Portland that has displaced 22 families, but you had the potential of high loss of life. You also had 2 additional medical calls again, and now we have a second residential fire at the southern area of the city. And so this network really ebbs and flows depending on what we face every single minute of the day. And it has to be responsive every minute of the day. Next slide, please.
Good afternoon, commissioners. This is Dr. Jones. Sorry, Chief Boone. I'll introduce myself. You paused a little bit here as well. This slide, I have one slide here that I'd like to discuss with the commissioners here as well. The first one from a medical model is the following. I've been with the city for over 3 decades as the County EMS Medical Director and the City of Portland, Portland Fire Medical Director. Since those 5 years, our volume of medical calls have gone up from approximately 70,000 to 112,000, I believe, last year, without a corresponding increase in Portland Fire staffing, et cetera. We have increased the ambulance, but I'd like to highlight the following. I'll let the chief talk about the fires, but number one, that we were doing very well. If you see in 2016, the cardiac arrest survivability rate. This is the survivability rate, essentially, of people walking out of the hospital with good neurological outcome here. In other words, able to eat and do their normal daily living. Our peak was 2016 at 20%. This is 20% of all people that we attempted to resuscitate. We had a slight drop in 2017. In 2018, we went back up. In 2019, we sort of dropped to 2017 volume. 2020, as everybody knows, was COVID, and this is an outlier, but we had an increase in cardiac arrest survival in increased cardiac arrest incidents in 2020 here as well. So I want to point out the following, that the response time is really critical to survivability. Let me repeat that. Response time is really critical to survivability. Our data would show the following. The optimal response, obviously earlier the better, but 6 minutes is probably where your upper limit should be for a cardiac arrest. Essentially, the brain dies after about 5 minutes without any good CPR. If you look at the response time, unfortunately, our Portland Fire has gone to 7.5. The chief can give me the exact date. Minutes here, gone from a 5 minutes. So we've gotten slower in spite of the fact that the increasing volume. So our cardiac arrest survivability is completely dependent on the response time. I can tell you that our ambulance response time has not changed. If anything, we've gotten better in our care. So there's only one variable that's really pointing to this here as well. Back to you, Chief.
Thank you, Dr. Ju. I won't spend too much time on this. This is just a snapshot of where we are. We respond to 90% of the calls in 7 minutes and 38 seconds. That's been the average. And trying to meet the goal when it comes to 5 minutes and 20 seconds, 90% of the time, as you can see, we make that about 55% of the time. And then I already talked about the importance of trying to keep fire at its most earliest stages, incipient, contained to the room of origin or structure of origin, and once it spreads, it's really obviously harder to control and contain. Next slide, please.
Commissioner Harrison, did you have a question on this slide?
Yes, Mayor. If we could go back, thank you. I just want to see if I heard Dr. Ju correctly. Are we saying that in 2020, the survivability of someone that fire and rescue went out who was suffering a cardiac incident, they only survived 10% of the time? Is that what we're saying?
Yes, Commissioner. It's the true number is about 10.5 to 11%. That's correct. This number is correct. I validated personally.
And so I'm curious because sometimes fire is able to get there before AMR. Sometimes AMR arrives first. Do you, if you matched up the data, what would be different between AMR and fire and rescue?
The data would show the following. 1/3 of the time, fire beats AMR by 30 seconds to a minute. 1/3 of the time, they both arrive at the same time. And 1/3 of the time, AMR beats fire as well. And usually the real issue there is, as the chief sort of said, it depends upon the volume and the tempo of the area of the city. It turns out that the East County area are our heavy volume, and that's where most of our cardiac arrests are occurring. By the way, they're in our disadvantaged population areas as well.
Yeah, I would definitely like to dig in deeper to that because I see a lot of overlap between AMR and Portland Fire and Rescue. And sometimes it looks like it makes sense and sometimes it doesn't.
Let me highlight one more item, Commissioner Hardesty. In order to handle a cardiac arrest, you need a minimum 4 people, optimal 6 people. So AMR is basically defensive only, can only do CPR essentially. So you need both units to effectively run a cardiac arrest.
But that also means that we're subsidizing a private ambulance function.
You could look at it that way. I won't disagree with that, but the point is that we need to have my mission as the doc is to save lives as well.
I agree with that, but I just want to put a pin in that because that's been an issue and it will continue to be an issue unless we actually resolve how AMR and fire and rescue are interacting and engaging. Because I going on some of the ride-alongs, it's clear to me that we are subsidizing a private entity, and we should not be. Thank you.
Yep. I can go on record. My job as a medical director is to make AMR nonprofit. So I'm just saying that in sort of a joking way. I shouldn't say that with the commissioners here.
It's all good. This is only public record. It'll be fine.
Next slide, please. So when we look at the impacts, when it comes to response time, when it comes to keeping fire spread to the room of origin, you look at cardiac survivability rates, where the shift is happening and where it needs to happen is getting resources, adequate resources within the community in order to have access to care. We are seeing chronic health. We're seeing when it comes to mental illness, and we're seeing when it comes to substance use addiction. These are a lot of calls where you can find a more appropriate resource, more appropriate responder, how we triage calls, but it is going to appropriately address part of the volume of the calls where we can still maintain an emergent response. The other areas, when it comes to the safety of community, prevention saves more lives, preventing a fire from even starting in the first place. And so for our program, we are investing in prevention strategies. That is the upstream work. It is assessing risk when it comes to commercial buildings and multifamily residences, creating safer environments and reducing the number of responses when it comes to fire. Our upstream work includes public education and code enforcement. Another critical upstream service is plans review for new construction. This involves identifying a building's fire protection features and life safety features. Reviewing plans also ensures when seconds count, firefighters are able to access the property and provide the necessary assistance and have the appropriate firefighting water supply to contain and extinguish the fire. I also want to highlight, and this was under the previous fire marshal, and I need to acknowledge this because he's extraordinary. But with Nate Takara and Dr. John Jay, who's assistant professor at Boston University's School of Public Health, they developed a new tool within the prevention division and implemented in June of 2020. This was a new predictive risk modeling that identified properties that have greater risk of fire and loss of life, which has allowed us to tailor our inspection efforts and educational outreach. This new algorithm uses data such as building characteristics, location, and fire data to determine probability of risk. And there are currently over 41,000 inspectable facilities in the city of Portland. And by applying this risk ranked model, we've identified 5,882 locations with a greater risk for loss of life in the event of a fire. Our 14 code enforcement inspectors and our public education office use this strategy to ensure resources are focused on the highest priority occupancies. Next slide, please. As we have seen, the 911 system has now become the go-to for primary care. And that's not a very efficient or effective utilization of the system. And it's not improving health outcomes for communities. Portland Fire, just like the fire service across the nation, is looking at ways on how to work upstream and connect people with appropriate resources. The CHAP program started in 2015. We started tracking high utilizers to the 911 system, which was more than 3 calls in a month. And companies would refer because this wasn't an acute emergency. And then we would connect with social services, appropriate care, and resources. In the first cohort group, you saw a 61% drop. In the second group, you see a 59% drop. And really, again, it is helping people navigate the healthcare field, which is very, very hard for most of us. But when it comes to services, we have to connect with other, whether it's the county, whether it's other nonprofits, in order to provide appropriate care. And so from CHAT, you had 2 people work in CHAT, Tremaine Clayton and Lisa Reslock. Tremaine was able to see this referral side where companies would respond and then refer to the CHAT program, and he would connect them to resources. It was his vision within the Bureau where he said, we should be able to put this and respond to people's needs first and tie them to appropriate care. And hence, through his research and his connection, and the program manager, Robin Burke, will speak to it a little bit later, but it started from CHAT, and now you have Portland Street Response. The other CHAT person, as Tremaine was working on Portland Street Response, you had somebody that understood when it came to crisis that the partnerships that were developed within CHAT, we still maintain them, which is why we were able to spin up Meds on Wheels and COVID testing, as well as vaccinations. So the relationships have been building for years. Next slide, please. And then the last part of our upstream work and investment when it comes to, it's not just core services, but it's large disaster events. And as PBEM and the ECC, when it comes to resources and communities and recovery and resiliency, somebody still has to go into the hazard zone. So we also sit at the table when it comes to the planning with other bureaus and PBEM on a local and a regional and a federal level. And we also have to be appropriately trained and ready to respond to a hazardous materials leak, a wildland urban interface fire, preparing for earthquakes, and as we saw earlier this year, extreme winter weather. Next slide, please. Portland Fire's budget constraint, 5% budget constraint, and add backs. We currently have 6 positions that we are not going to fill and leave vacant, as well as decommissioning the historic fireboat Campbell. We've been asked to identify a $6 million in reductions. Our main goal in all budget decisions is to maintain frontline services. After cutting these 6 positions and retiring the fireboat Campbell, there was still over 5 million in reductions needed to meet the 5% constraint, which could only feasibly be met through reductions in frontline services. We are asking for restoration and add back just to maintain staffing, just to maintain, not in addition. And so our add back request is to maintain the 4 RRVs as well as 1.5, 1.5 fire stations. It's important to talk about fire statistics and fire spread just a little bit more. I know I'm going over, and you can stop me if
No,
you do.
Actually, Chief, I just wanted you to tell my newer colleagues what an RRV is and what they do in response to a 911 call.
Yeah, so a rapid response vehicle, as I had mentioned earlier, we had shifted resources in order to deploy 2-person rescues in order to meet a higher demand run volume. And one was to improve availability for higher critical calls, but the other was the non-emergent calls where a 2-person rescue could respond. Maybe it was a lift assist, maybe it was a medical alert, but it was the lower acuity calls and also being able to help with the demand and be responsive to the communities.
So it's a quicker response with a smaller crew. Or it's a smaller crew that's more nimble.
It's a smaller crew that's more nimble, but only responds to non-emergency calls, right, which allows our 4-person crews to respond to higher acuity calls.
Thank you. Yeah, I just didn't know if my other colleagues had that, knew what they were. So, and especially for the listening public and our budget committee. Thank you.
Yes. So I will close because I think it's really important to make it across the entire system. But I just want to remind people that Portland Fire and Rescue, their part within this system, not only is an emergency responder, but an all hazard response. PF&R makes up 2.7% of the city's entire budget. But firefighters have had to be cross-trained and trained because of the city's risk when it comes to a population and when it comes to the infrastructure. In addition to providing core services, it's specialty rescue, it's hazmat, it's marine response, it's shipboard, it's liquid fuel storage, fires, industrial firefighting, advanced life support for EMS, interior structural firefighting, wildland urban interface firefighting, surface water rescue are just a few of the things where firefighters are trained at the awareness level, the operational level, and the technical level. But in addition to that, we are invested when it comes to looking at this system and communities. We're working with BOAC when it comes to ProQA, medical priority dispatch, and being able to re-triage when it comes to fire calls and EMS and sending the appropriate resource. We're incorporating Dr. J's risk analysis and new algorithms when it comes to identifying high-risk occupancies. We are investing in new web-based technology to enhance our performance and response with real-time analytics. Our community chat health team, as you had seen over the last year, is critical when it comes to the health of a population. And then when it comes to the environment and climate change, we're leading the way when it comes to investment in hybrid electric engines. And then the last, we have been supportive when it comes to Portland Street Response. We have redirected and reallocated 3 positions. Tremaine Clayton, who had the vision, Robin Burrick, who is the program manager, and then we also a communications person. And so I will turn it over to Robin Burrick unless council has questions.
Chief, I've got a couple of questions that your presentation raised. And first of all, thank you very much for the presentation. It's thoughtful as always. So the add back proposal, I've seen it 5 times, 5 years in a row. And so I'm not surprised by it. And the council is always in a quandary, as are city councils nationally, when discussing fire and rescue budgets, because it is life safety versus dollars and cents. Life safety talking points always dominate dollars and cents. But the reality is we live in an environment of a constrained budget where we have to make difficult choices. And so my question really is around some of the assumptions underlying the basic operating model. And I appreciate you saying you support the street response. Commissioner Hardesty put a very valid issue on the table with regard to the services we are providing, particularly around non-emergency transport. You raised the question of, all of the firehouses. 4 years ago, the city council passed a budget, went through a very difficult process of allocating resources amongst firehouses, and we made the tough political decision to close one and came up with alternative strategies. And what happened was the Fire Bureau restarted that firehouse without telling anybody, and then basically dared us to close it again. The rapid response vehicles are critically important. And what we're seeing, I think it's been said that something like 95% of the calls are now non-fire. So, and that may not be quite, or what percentage of your call outs are fire?
Chief Boone, do you want me to jump in on this one? This is
I don't want to give bad information. So give me the right number there. Is it 60%? Is it?
This is Ryan Gillespie, Division Chief of Emergency Operations for Portland Fire. Good afternoon. So we're at about 70% of our calls are medical calls, with the remaining 30% being fires and other rescue hazardous materials type of calls. So I don't have the numbers if you disaggregate just the fires out of that, but I don't know if that's helpful to answer that question.
It's not necessary right now, Ryan. I appreciate that. I guess my larger point is this. It appears that with time we are migrating towards more what I would describe as medical response type calls. We also have to have a baseline of preparation and response for all those other things you described, whether it's a fire, a boating accident, some sort of a hazmat spill, something on the train tracks, whatever else, right? And so the key here for the council is you have to maintain some level of base service for all of it, for when things go horribly wrong. But we also have a growing medical response issue. We have 2 different groups in the city that provide that service. As Commissioner Hardesty just noted, you have Portland Fire and Rescue, you have AMR, you potentially have some other first responders in the mix too, but predominantly that's sort of the mix. We have the fire trucks that are currently staffed per our collective bargaining agreement, I believe with 4 personnel, is that correct? So we roll with 4. Other cities have questioned that model and have changed that model to reflect that a lot of the calls are not in fact required. They don't need the full vehicle to respond. They need a smaller medical vehicle to respond. I think Denver is an example that's often held up. Is there any consideration of looking at alternative delivery models, given that the service mix is changing, it is dynamic? Is there room for the organization to change in order for us to reflect the changing needs of the community, while still maintaining that basic level of service across the board for when the proverbial fan gets hit?
Thank you, Mayor, for that question. There's a lot in there. Let me first distinguish between when we talk about a more appropriate responder when it comes to medical. That is an area we can have a great conversation and find a more appropriate, cost-effective response. What we are talking about, though, when it comes to emergency response with fire in our standards, and it isn't just because Portland wants to do it, we base it off NFPA, right?
Oh, what? Sorry.
The National Fire Protection Association. So they, just like the electrical codes, just like the fire codes, they do a lot of research. They work with NIOSH when it comes to firefighter death, when it comes to civilian death, OSHA, all these things. We put best. So the hazards that a city has, depending on the risk, it's the type of emergency, requires 4 people to be able to initiate certain actions depending on what the emergency is. And so as I refer back to, we are a metropolitan city. We have high rise, right? We talk about all the risk. Where I want to be really careful is this city, this council, and you deserve a better response deployment model. But that's going to take time and research and in-depth analysis. And so we did go for a grant last year because we looked at Station 23 and we couldn't give you guys anything grounded with a true analysis and assessment of where we are today. We haven't done a city risk assessment and deployment model as service delivery since 2011. And that was just if we needed the RRVs. The last time this city has had that done is in 2006. So Mayor, I'm with you. We contracted with Citygate. They are going to come in and they are going to look at this risk. They're going to look at the property value. They're going to look at the critical infrastructure. They're going to look at different response models. They're going to incorporate a lot of the stuff that we've been doing in prevention when it's talking about the social environments in which communities live. We need to do that. And we are going to do that. And council's voice will be embedded in that. Community's voice will be embedded in that. I'm sure the new safety transition director will be involved in that, and firefighters. But I will say this, whether it's medical, a first responder on medical, whether any other responder, I don't know who else we are asking to go into the hazard zone except for fire.
Yeah, and that's a fair response, and I'm glad to hear that that study is finally getting the attention it deserves under your leadership. So thank you for that. I do agree. I think that the joint public safety director, I think we've announced that, but I'm not going to take the risk that we haven't. The new public safety, has it been announced?
It has been, yes.
So, Mike Myers, who certainly knows the totality of our public safety infrastructure well, can certainly be a strong partner to all of us as we do that investigation. And I appreciate that response, Chief. Commissioner Hardesty.
Thank you, Mayor, and thank you very much, Chief. And I know Jessica has the hardest job today, trying to keep us on time and on track. And so I'm going to be very brief. First, I just want to say, Chief, your team of professionals inspire me each and every day. And it has been phenomenal over the last year watching how fire and rescue has been able to adapt based on what crises we were in at any given moment. It is impressive to me that we have professionals that right away stepped up and said, we need to make sure that we are the ones that are going to vaccinate our most vulnerable community members. I could pick the wildfires. I could pick any one of the disasters that you've been involved in this year. and just say that I'm just in awe of the fabulous men and women who represent fire and rescue, because not once have I ever heard a firefighter say, well, that's not my job. I can't say that in too many other city departments, but I know in fire, no matter what's happening in a city, they will adapt and do whatever is necessary to keep people safe. And so please make sure your team knows that they have my deepest gratitude and respect for what they do every single day. Having said that, I know that and this is more of a first responder system. I heard Director Kazi talk about a training facility for backup for 911 communication. The chief knows I've been working very passionately around getting a new fire training facility. I brought to this body recently a desire to talk about how do we collectively create a first responder training facility using land we already own, co-locating with Portland Police Bureau, because it is my belief if we are developing a system of first responders, we should be training them all together. So thank you all. And so just wanted the other directors to know that we're just starting that conversation. So hopefully we're all going to be moving in the same direction as we talk about that moving forward. Thanks. That's it.
Thank you, Commissioner. Thank you, City Council. And program PSR Program Manager Robin Burke. Thank you.
Thank you so much. I appreciate it. And I will do my best to be brief. And so that way we have enough time for PPB. Thank you for having me today. It's truly an honor to be here representing Portland Street Response. And it's exciting because this week was actually our 1 month anniversary as well. So next slide, please. You know, in preparation for today, Council asked all of the public safety bureaus to really reflect and think about how we're ensuring equity and accountability in our services. And for me, it gives me such great pleasure to know that Portland Street Response is even in existence today because we are making the effort to respond equitably and have accountability in our services. And so, you know, in large part in 2019, Portland Street Response came into being because advocates from the houseless community said that they wanted better, right? And so when we think about the houseless community, oftentimes we think of it, we lump them all together, but it's not a homogenous group or community. The homeless community is really broken up of different communities and different populations. And you see here transition projects, they've cited back in 2019 that there was a 14% increase people with disabilities, a 37% increase with the chronically homeless, and a 75% increase with people over age 70. What's not listed here is the BIPOC community, which we know the BIPOC community comprises about 38% of the homeless population. At least it was in 2019 when the count was originally taken. What's also not listed here is the LGBTQ community, as well as those struggling with chronic health issues and those struggling with chronic mental health issues as well. And so historically, first responders, and I know this because I used to supervise the data analytics for fire, we haven't always done a great job in capturing that kind of information. Next slide, please. And so when we think about what are the critical outcomes of the traditional first responder system, we see this model at play. So oftentimes with these communities and these populations, they don't typically call 911 themselves. In fact, they're usually called on by somebody else. And our BOIC dispatchers then had three choices. They had police, they had fire, and they had AMR. Now, police, they have reported that only 5% of their total responses result in an arrest. And for fire and for AMR, we know for those four call types listed there, behavioral, unconscious, overdose, and unknown, which typically involve a medical component related to a houseless individual, mental health issue, and substance use, that 24 to 30% of the time police are either called or they're transported to the emergency department. So we know both of these systems, the jail system and the emergency department systems, are overwhelmed, and we see a high recidivism rate. Just last October, the Oregonian reported that there's an 87% recidivism rate among the houseless population through the jail system. So I do also want to talk about, this is the first responder side and the traditional, but I also really want to acknowledge and honor the BHU team and the chat team, both in police and fire, because they are really trying to break these two systems. They're trying to get upstream. For police, they are referred by fellow police officers. When we have high utilizer calls, the BHU team gets involved. They're contracted with Cascadia, and they send out LCSWs to try to work with individuals to help break that cycle of recidivism within the jail system. For fire, we have the chat team, which has just done a tremendous job working to address the trimorbidities that are leading someone to rely on the 911 system again and again. And so these two programs are prevention. They're trying to get upstream, and it's exactly what really has laid the foundation for Portland Street Response. Next slide. So Portland Street Response is this new option and opportunity for callers and for boat dispatchers to rely on. Our goal, of course, is to be able to de-escalate in the field, to provide first aid medical care, hopefully diverting people away from the emergency departments unnecessarily. And also what we've done is we've taken the BHU program and we've taken the chat program, and instead of those being referrals, we've transformed it into the first responder side. So we have 2 community health workers who can now meet us on scene at the time of the call rather than relying on referrals and waiting for them to become high utilizers, who can then work with people to get them connected to housing and shelter, get them food assistance, get them into treatment, mental health or substance use treatment as necessary. Next slide, please. So the types of calls that Portland Street Response are responding to on and I will just say major kudos to BOIC right now and their dispatchers. They've done a fantastic job this last month dispatching us to the appropriate calls. We are responding to calls in which somebody is down, unchecked, their condition is unknown, person is intoxicated or drug affected, the person is outside yelling, or someone just needs a face-to-face mental health check and assessment. We actually have a really great success story where we were actually asked to go out to a homeless camp to do that face-to-face mental health check. And someone told us after we finished working with them that we saved their life, that they were going to take their life. And we were able to intervene and help them and get them the help that they needed, which gave me chills when I learned that. So 2 criteria that must be met. It cannot be a medical emergency, and there cannot be a crime being committed or a threat of danger present. If those cases do occur, then we will certainly involve fire, AMR, and police to make sure that we can co-respond on those. Next slide, please. Our 3 intended program outcomes are to reduce the number of calls traditionally responded to by police where criminal activity is not present, to reduce the number of people transported to the emergency room for non-emergency medical related issues that could instead be addressed in a pre-hospital care setting, and to reduce the number of behavioral health and non-emergency medical calls traditionally responded to by police and fire. Those are all very centric on having an impact on the first responders, but I do want to say the community at large is what's really driven this program. And next slide, please. I'll talk a little bit. We are very much so dedicated to making sure that all who are involved are better off, not just the first responders, but the community that we serve. And so here's just a few. This is just a sample. You can see this kind of broken out by 2 categories of things that we're tracking: critical outcomes and then call disposition. So understanding, just as I said, the homeless community, they're not homogenous. There's lots of variations there. We need to have a good understanding of who we're serving and what the needs are. So you can see percentage of calls related to drug or alcohol use, the percentage of calls related to mental health, comorbidity involving drug or alcohol use and mental health, calls involving a homeless individual, and the percentage of calls that are repeat utilizers. From the critical outcomes, this is about understanding how effective are we, and and also allowing us to make sure that we're the right responder that's going to these calls. So what percentage of calls result in requests for police assistance or fire or AMR? What percentage of calls result in arrest, citation, or director's hold, which that just means somebody is involuntarily hospitalized, or a percentage of calls that result in physically violent encounter. And then this last one I really want to highlight, which is the percentage of calls that result in referrals to outside agencies for assistance. So one of the things that, we continue to hear is that the system is broken. Oregon ranks at the bottom in terms of mental health treatment and substance use treatment availability. And everybody can talk about how the system is broken, but we want to collect data on what is broken specifically. What are the gaps in the system? What are the barriers to getting people into treatment? We should not have a treatment system where the barriers to access treatment is higher than the barriers to go to jail or the barriers to go to the emergency department. We need to change the system, but in order to do that, we really need to understand where the system gaps lie. So my hope is that our charting system has been built so that we can collect information on who we're making referrals to, how long does it take them to get into the referrals, were we successful in making those referrals, what were the barriers to getting someone connected, and then we'll also plan on having follow-up with the individual after they've received the service to see what was the quality of service that they received, because we don't want to refer someone to an agency or a service that might cause secondary trauma or not be helpful to them in the long run. So my hope is at the end of the year that I can take this information to council and relay all of the information that we learn from that data, and then that will lead to some great conversations that you have with the state and with the county. Next slide. Portland State University, we're working with them as well. And one of the things when I took results-based accountability that I really loved from that training was this question of, are we better off? So thinking about our PSR staff better off, our police and fire better off with Portland Street Response, our businesses, is the Lentz Neighborhood and Business Association better off? Are other organizations better off? And most importantly, our callers and beneficiaries of our services better off. And so that's what we hope to capture, and with partnership with Portland State University and their program evaluation. Next slide. Lastly is, you've graciously given us $4.8 million for ongoing dedicated to this budget. And so with that $4.8 million, we're requesting 22 additional FTE that would bring us up to a total of 29, $3.3 million in fiscal year 21-22, $3.6 million ongoing annually. The decision package with the 29 will support about 2 24/7 response units, possibly a third that could operate on a peak demand staffing level by the end of fiscal year 21-22. So if there are no further questions, I'm also happy to go ahead and hand it off to Chief Lavelle.
I have one question. Thank you for both a succinct and useful presentation. That was actually great. Thank you. And I appreciate you being very clear about what your metrics would be and how you're going to define success and where you are in the program. It looks great. Obviously, I support it. The question I have, is there an assumption built in? This is only the pilot project we're discussing. So there is not an assumption already built in that this will reside in Portland Fire and Rescue, is there?
There is not an assumption that it will reside in Portland Fire. I think
that was my assumption. I just wanted to make sure. Thank you.
Mm-hmm.
All right. Get my slides here. I've got Nathan from our BSG helping me with slides. So good afternoon, Mayor, City Council, and colleagues. I'm Chief Chuck Lavelle, and I'm pleased to be here today to share information about the Police Bureau's budget, the questions, challenges, and opportunities we face as we look into the future. Our strategic goals provide the framework for everything we're trying to accomplish and discussing today. Over the last several months, we've heard from community members, and we understand they want appropriate police response, and they want to feel safe in their community. At the same time, they want PPB to be a re-envisioned agency, one that is equitable, visionary, innovative, and open to change. We share this vision. When other systems don't provide community members the care and support they need, police become the response of last resort. But police agencies are not social service agencies or workforce development agencies or housing placement agencies. We're part of a social safety net, but we're only one part. We are encouraged by the promise of 311, Portland Street Response, and other systems of care, and can bring law enforcement expertise to situations that it's the most appropriate response. As the chief, I'm excited to work with community and city council to advance the changes on the horizon. Let's begin with a more detailed look at our structure and calls for service. This org chart shows the police bureau with our 3 branches and what divisions or units we currently have, as well as what's under my supervision. Under our ops branch is our calls for service. The investigations branch is follow-up from those calls, and our services branch is our support divisions and units. Directly under the chief's office is professional standards, inspector, community services, and equity and inclusion. This is the percentage of staff that is in those branches. Operations, which is essentially our 3 precincts, is half of our resources. The police bureau is authorized to have 916 sworn employees. We currently have 823, which means we're holding 93 vacancies. We currently have 246 professional staff members and 46 vacancies there. This affects our response time and the ability to meet our core functions. This is an overall snapshot of where our dispatch calls for service were over the last several months. Officers respond to every neighborhood and every part of the city. These are some significant challenges we're facing. And violent crime remains a grave concern. We've seen a tremendous increase in shootings and homicides in our city. Already this year, we've had about 25 shootings and 21 homicides, including the one from last night. In 2020, we had a total of 892 shootings and 54 homicides. We're working closely with the mayor and the community on several initiatives to curb this violence. We understand this violent crime has caused deep trauma for many community members. These community members continue to advocate for police to reduce violent crime. We'll talk about reform in a few minutes. To go to the next slide here. But we know we must continue to make changes and be a progressive agency. We list reform under challenges, but we also understand it's an opportunity. However, implementation of change always brings organizational and structural changes that will need to be addressed. At this time, retention of our employees is a critical concern. We have seen a historic number of resignations from the Bureau since last July. By the end of this month, we project 116 people will have left the Bureau. This includes 74 to retirements and 42 to resignations. We've seen years of experience and knowledge, basically our significant investment in people, go out the door to other agencies. For me, it's been striking to see employees with many years of experience leave. And these are not just our new hires. There are currently 2 billboards in our city advertising for lateral officers to transfer to other agencies in other cities. The challenge regarding our structural deficit remains. The Bureau has used salary savings for years in order to meet the budget, but we do not have the funds to be at authorized strength. We often talk about calls for service. However, investigations is also a core function. Our investigators have been overwhelmed with crimes against persons. This means assaults, shootings, homicides, and more. These investigations take longer and are more complex. That is where the bulk of our resources are. We're not fully staffed in our detective division, and we're finding the ability to address property crimes has diminished. We only have 7 detectives to investigate all the burglaries, frauds, vandalisms in the city. We want to improve response times. In discussing response times, several factors are at play. Certainly, staffing is one of them. We also have to consider the number of officers required to go to certain calls, such as domestic violence, which was mentioned earlier. Violent crime also requires more officers. A shooting needs officers to secure perimeters. assist victims, talk to witnesses, gather evidence, and possibly locate a suspect if one is still believed to be in the area. We have cover officers responding, officers traveling greater distance, and if there are shootings, homicides, or other violence occurring, those will take up the bulk of our resources. We understand that even one extra minute can be the difference to a domestic violence victim being assaulted or a suspect who's fleeing. I want to provide you with our vision for the Bureau, which includes trust, community engagement, and excellence, reform, and retaining our employees. We realize that trust remains the #1 factor in any relationship, and our focus must continue to be on earning and rebuilding that trust. How do we rebuild trust? We do so through demonstrated listening, community engagement, and more. But first, police must respond and address public safety calls for service. This is still our core function. As you can see from the dispatch calls for service, our community is still asking for a police response, and they want and expect that in a timely manner. Our calls for service have been slightly less during the pandemic. Obviously, our regular calls for service were impacted. For example, there are no children in school, no people in the entertainment district, bars and restaurants were closed, and less people driving and using mass transit. As things begin to open up, our calls for service in those areas will resume. We can say for sure people still want a police response for certain crimes, and we do not expect to see a sudden decline in calls for service from people who need help. Trust can also be affected by a person's feeling of safety in his or her community. Throughout this recent increase in gun violence, we've heard from many community members who have told us they no longer feel safe and they want the violence to stop. We've been asked by people in Portland if Portland is still safe or if they should move out of the city. We've been asked by people if they can do the basic activities such as have their kids walk to school when they open, visit parks, and walk in their neighborhoods. We want a community where people feel safe in their homes, public spaces, and we remain committed to prioritizing this. Last month, I did a reorganization of the Bureau and reassigned 99 sworn employees back to the patrol function. We sent officers from traffic, K-9, community engagement, public information, narcotics, and behavioral health back to patrol. We did not change our minimum staffing numbers. This was done to curb overtime, as we were forced to hire officers on overtime almost 43% of the time on every shift, every day to make our minimum staffing numbers in the precincts. It's critical we have the people in patrol to respond to calls for service. Patrol and investigations must always be the primary focus for our community to feel safe. As our new hires do get fully trained, we'll have a slight increase. However, in 2022, we are projected to have another big retirement wave. 88 sworn employees will be eligible to retire in July of next year. Ironically, this chart is already out of date as we have three people who will resign by the end of this month, and at least 4 that I know of who are in the process of getting hired with other agencies. Unless we stabilize our staffing, we'll continue to see impacts in response time, community engagement, and investigations. By the end of this month, we'll have 116 sworn employees who have either retired or separated this fiscal year, and we have not hired one person. If we begin to hire again, it'll take 18 months to 2 years to recruit, hire, and train the kind of officers we want in a progressive agency. So we're asking for ongoing funding for positions to be competitive with other agencies. This may affect the decision-making for the candidate who can choose between going to a law enforcement agency where a position is funded or one that's only funded for a period of time. Also in 2 years, if the positions are not funded, that means we just spent 2 years training and investing in someone who now goes to another agency. Our hiring process is complex. In order to build the next generation of officers, we need a collaborative process with community, Bureau of Human Resources, and our other partners. We need time to build in the input from our equity and inclusion team. We must be ready to recruit, hire, and train these new hires. We must also invest in our detective division so victims know their cases will be investigated fully and then forwarded on to the DA's office for consideration for prosecution. And finally, we need to ensure we meet our metrics on timeliness of internal affairs investigations and are asking to fill a vacant position there. Building trust also means interacting with our community. Community engagement is very important. It allows our community to feel heard. Internally, it allows officers to talk to people when they aren't in crisis, giving officers a better perspective on people's concerns or feedback. I found community engagement means different things to various people. For some, it means events such as National Night Out, community forums, and things of that nature. For some, it's community policing model where officers have time to walk in their districts, meet up with business owners or residents, help them work together to solve problems and chronic issues. That model has proven time and again to be effective, but we're limited right now in doing that. COVID restrictions plus our limited staffing has impacted our ability to have many community engagement opportunities. When I first took over as chief, I envisioned a community engagement unit that made this critical function a priority. However, those officers were needed back in patrol. Despite this, I believe we can still have valued interactions with people when responding to calls. However, keep in mind that building a relationship does not happen when a person is in crisis or is victimized. We believe the public safety support specialist provides much needed assistance on certain calls for service, freeing up some officer time. Their outreach and engagement occurs in low priority calls where a victim is not in crisis and they can spend more time with them. We want to increase the number of PS3s who are able to take these calls and be another outreach component as the city opens up and we're able to attend events again. Our goal would be to get enough PS3s to allow us to have a second shift, and this would provide assistance to officers working on the afternoon and evening shifts. We can be proud of some of the work not only the Bureau has done, but also community and the city over the past 9 years when it comes to reform. The Bureau has revamped its policies and training, especially in regard to force. We implemented our behavioral health unit, our inspector general position, and more. We've rebuilt our advisory councils and implemented a training advisory council. We're a vastly different agency than we were a decade ago. We've been committed to ensuring an equity lens is applied to everything we do, and that our equity and inclusion team is included in reviewing policies, training, hiring, and other practices. We remain fluid and committed to always growing and developing. We've listened to our community, and we know people want us to be on the forefront of all police reform. We're open to innovative ideas in public safety. We support ideas to provide services to people when police would not be appropriate. Until those services are fully functional and embedded, we'll respond and connect people with the appropriate resources when possible. Our add back package, as you can see here, contains.
Excuse me, Chief, Mayor, if I may, could you go back one slide, please, Chief? Tell me about the community. Tell me about this chart. It popped out to me that there was one community-based organization listed by name, and then there was a coalition of advisory groups. What does community-driven mean to you with this chart?
Yeah, I think for us, community-driven, it does include our advisory councils. We do have a lot of interaction with the listed group, IPAC, but we attend a lot of community events. We have a lot of interaction with PSEP, the Portland Committee for Community Engaged Policing, and a lot of other community and faith-based organizations. For the purpose of this chart, we couldn't list them all.
Well, I mean, for the purpose of this chart, I would think that you would either list a number rather than an individual group, because there's a lot of groups. So it just stood out to me that there was one community group listed out of everything that's on this chart.
Yeah, I mean, we do have several. I can't get them all right here, but there are a number of groups we interface with and community organizations that we have a strong working relationship with.
I would love to see that list, and I would like us not to just list one, but either list them all or list none of them, because it gives one group an unfair advantage against all the other community groups that would like to be engaged.
Okay.
Thank you.
Sure. So this current slide shows our add back package. It contains needed command positions that help us accomplish what's outlined in the city settlement agreement, as well as an analyst and records professionals. We want to have a workplace where our employees grow and thrive. We invest a lot in them through training and development. To see them take that investment to other agencies is really devastating. We want to increase our internal legitimacy, and employees need to feel supported and encouraged. We have to be the employer of choice, and that means offering appropriate wellness programs and other factors that provide a work environment where they will thrive and succeed. I believe officer hiring and retention needs to be a citywide effort and priority, especially when the desire to have the best and balanced workforce. We want to keep the employees we have, and we're asking to maintain our core patrol functions while also ensuring we can achieve our minimum staffing numbers. Those numbers are critical in maximizing safety to the community and our employees. We believe we can reduce internal materials and services as well. By reorganizing and sending officers back to patrol, we hope to be able to achieve our minimum staffing and not have to hire officers on overtime just to fill those positions, which is a better use of our funds. We're asking for an add back package of $5.4 million. This would add 39 sworn positions and 15 professional staff positions. Adding these positions would still not let us shift resources back from the earlier reorganization that I discussed. I want to acknowledge the tough choices that you must make during this recovery period as we transition out of the pandemic. I believe public safety is at the core of a healthy, vibrant city. My vision is for an agency that strives for excellence in everything we do and meets expectations by our community. I want to recognize Portland Police Bureau employees who serve the community every day and do an extraordinary job. I also want to recognize all of the public safety partners. We are proud how well we all work together as part of the public safety system for the city. We'll continue to do so and look for ways to combine efforts or increase efficiencies in order to provide ongoing public safety service. I also want to extend a congratulations to Mike Myers for his new appointment as well. And that's all I have. If there are any questions, I'm happy to take them.
Colleagues, any questions for the chief? Commissioner Hardesty.
Thank you, Chief, for that presentation. As always, it was thorough, and I appreciate that. I have a couple of questions that I wanted to ask. There was a pilot that was started under Chief Outlaw that had a sergeant station at BOAC. We know that having a sergeant station at BOAC reduced calls. That sergeant pilot actually took over 15,000 calls, cleared 10,000 without actually having to have a police person go out and respond. And I noticed that you did not include that in this particular budget request. Why is that? That is a great way to reduce the response to 911 calls.
Yeah, that pilot program was very successful. That's something I think we're going to look to reinstate. Previously, we had done that by hiring a rotation of sergeants on overtime. And I think if we did go back to that, it would probably be with more dedicated, specific sergeants for the sake of continuity. But that is a program that I think was successful for us, and it's something we're looking to do potentially in the future.
I noticed that program saved over 6,400 patrol officer hours when it was in place. And again, we're not going to get to any staffing level that you would be comfortable with anytime soon. And so thinking about what we can do now to reduce officers having to respond, I would think that would be a priority. So I'm really interested. And you said having someone there permanently, I actually would think it would be a good rotation for sergeants to be on the other end of a 911 call, because it would help them do their job better on the street. That's just my opinion. Other people might differ. I'm very concerned about the PS3 program expansion. Based on the info provided, it looks like they primarily do paperwork. And when they're not doing paperwork, they're out addressing a stolen automobile follow-up. And so I would be very concerned about adding 10 more people who the primary part of their day is spent doing paperwork as compared to actually being active on the street. I think the difference between how this program has played out and how this program was sold to a previous city council has been as different as night and day. I would hope that the auditor's office would audit this program before we would even consider doing any expansion, because honestly, I've asked a lot, what do they do? And now that I have the data tells me they primarily do paperwork. And I don't know if we want to pay somebody $80,000 a year to do paperwork. So that's one question. I also wanted
let me respond to that if I could, and then if the chief has a different answer. First of all, to be clear, this is exactly how I sold it to the prior council. That paperwork has to be done. We can either have armed sworn officers who are trained to be out on the street do it, or we can have the PS3s do it. And we concluded that it was a far more cost-effective model to have the PS3s do it. I will agree in one regard that the program I thought would have been a larger and more significant percentage of our overall police, our overall response mix, because as is noted, a lot of the work that our sworn officers do, and it takes 2 years to train them, are things that could actually be done by the PS3. So I would actually sort of go, I hear what you're saying, Commissioner. I would actually come to the opposite conclusion, which is we should have more rather than fewer. And I've watched other cities with some degree of envy as they expand their non-armed components of their police bureau, while ours has remained relatively static.
I appreciate that input, Mayor, and I know we're not going to answer all these questions today, but I do think it's important to put it on the public record. I actually thought that PS3s would be responding to burglaries that had already happened, right? So the next day, helping people fill out their paperwork, telling them what the process would be. I thought they would do things like actually go to community meetings and actually talk about the work that the police bureau was doing.
Exactly, and that's frankly why I'd like to have more capacity. I agree with you on that.
Well, and I think if they're not doing it now, why would we assume that more capacity would allow them to do that?
Because there's only 12 of them right now, and that represents literally decimal dust in terms of the overall capacity of the bureau. It's 12 versus.
Okay, we're going to talk about this a little more. I do have a couple more questions. DPSST is not training right now. Do you have any timeline as to when DPSST will reopen and what their backlog is in people who were hired but haven't been trained as of yet?
I'm not sure what their current backlog is, but I can have my personnel folks look into it. I do think that they're probably going to be at a premium for spaces in classes. As you know, they have budget constraints as well. So
exactly. And I know,
Chief, if I may.
Yes.
DPSST has resumed training. We've had people down there. They have another academy class coming up in May of this year. So they do have the pipeline rolling again.
So they have started, and they just started when? Because that was recent.
It's been within the last couple of months, because I know that we have officers that are down there.
Okay, I see other hands, so I'm going to hold my questions. I do have some other questions that I'm going to submit to Director Kennard that I hope will inform our deliberation as we move forward, but I want to respect that other people want to weigh in as well.
Thank you, Commissioner.
Sure. And I just have an add on the PS3s. I think our ability to have more PS3s would allow us to expand them to the afternoon and night shift, where a lot of these community meetings are being held. So it would give us more capacity to interact in the community meeting setting that way.
Thank you, Chief. Frida, then Commissioner Maps.
Yeah, I'm staying on the PS3s. When I was reading the work session information, I noticed it did mention that they respond to schools. And the SRO program was disbanded just as schools got shut down. So it hasn't had an impact on our schools because we haven't been open. I would like to suggest, because a lot of the argument against SROs, I have to tell you, at David Douglas, we loved ours, but is the armed police officers, whereas the PS3 is not armed. Are you considering within the program, it's just an idea, that instead of sending a patrol person to the school when the school calls, because there are issues that occasionally are need a police response, that you would consider assigning specific PS3s to various high schools so that they can become familiar with the schools when they're called? Because I've been told when it's just a regular patrol officer, often a student that might have been talked down or an issue resolved instead is handcuffed and taken away. So I'm just trying to be a little more proactive with our schools, because we do have our incidents. And it seems like this would be an alternative to an armed patrol officer going to the school.
Sure. No, that's a good point. It would depend on the type of call, but I do like that concept. And I think the school environment really is one where some familiarity and relationships go a long way. And I think with the addition of more PS3s, we could look at maybe expanding some of the calls they take and their role potentially as well. So I do like that idea.
If they could have training similar on handling youth, that would also be, I know the idea was to have them in the community. This would be a way, but teenagers are a unique group themselves, so some special training in that area would also be helpful.
Commissioner Maps.
Mr. Mayor, I see that we're at time for this meeting. I'll let you decide if we want to go extend further, or let me hold my questions for now.
You've been very patient. Why don't we go ahead and get your questions in, then we'll wrap it up after that if people can stick around for a couple more minutes.
Okay, great. I'll be real quick. First, I want to underscore Commissioner Hardesty's support for the embedded sergeant program. From the evidence that I've looked at, it seems like it made a big difference and might be a way for the Police Bureau to save some dollars and for us to provide better service to the public. And then I have two questions which I want to invite the chief to respond to real quickly. One was Commissioner Hardesty posed a question about basically about the impact that the PS3 program has had on the functioning of the Police Bureau. I'd like to actually invite you to tell us, like, has it improved our response times? Does it change our staffing ratios or whatnot? What are we getting from that program so far? And the second question, which I'd like to see you respond to directly, is tell us a little bit more about the wellness program for our police officers. You're a big hunk of our city workforce. Obviously, your team has been working under tremendous pressure. We see lots of people leaving the Bureau for various reasons. Can you tell us more about how we're taking care of our staff?
Sure. Thank you for those. As far as the PS3 question goes, I think what they've really done is increased our availability. A lot of the things that they do, and kind of to Commissioner Hardesty's point, a lot of the things they do revolve around lower level activities that would take an officer off the street to engage in. So waiting for a tow, picking up property, going to the scene of a crime to collect video, things of that nature. And a lot of these types of things involve paperwork as well. So I think that's why you get kind of the paperwork piece, but that's otherwise time that a sworn armed officer who could be attending to other more serious crimes would be tied up, attending to. So I think that's where it's really helped us. And we've gotten good feedback as far as the community engagement piece. People like to see, these unarmed officers who are there with really, kind of the goal of helping them in the immediacy of their need, where an armed officer is not necessarily needed for their call. And, if we expand it, I think there's an opportunity to look at some other roles that they can fill. And as far as wellness, as you know, this has been a really tough summer and early springtime for our officers. A lot of our members from the rapid response team who had been on the line this summer during the crowd control events, we did a wellness program for them, about 70 hours of wellness time to help them kind of recover and basically kind of recharge as far as the things that they've dealt with all summer. A lot of just tough work that they had to do on a night in, night out basis. So we wanted to make sure we gave them some time, and we really were attentive to making sure that their wellness was a priority. We took that 70 hours, and the training division is now looking at having a course that we can offer to other officers and even our professional staff who feel that they could benefit from it. I think the feedback has been that it's been really positive, and it's allowed people to really kind of ask questions, think through some of the things that came up and were challenges, over the last 9 months or so.
Thank you, Chief. I appreciate you, those answers, and the work that your team does.
Thank you, Commissioner.
All right, very good. And thank you, Chief, for your presentation. Director Kennard, thanks to you and all of the Bureau directors who gave us fantastic feedback today. I know we all wish we could go on for another 3 hours. We could probably easily do that, but most of us have evening meetings, so we'll have to postpone. Folks, we are reconvening Tuesday at 9 a.m. to talk about laying the groundwork for economic recovery. So that should also be a very interesting conversation. And until then, we are adjourned. Thank you all.